Good morning and welcome to the October 5th Health and Social Services meeting. Can I have a call the roll? Okay, thank you for confirming attendance. Is there any declarations of interest in any agenda items in the Health and Social Services agenda today? Hearing none and seeing none. We have no statutory meetings. I need first the adoption of the minutes from September 7th. Can I have a mover? Councillor Anderson, second by Councillor Dice. Questions? Seeing none, hearing none. We're going to move over to our presentations, and I'm going to call upon the Chief, Troy Chewsborough, Chief of Durham Paramedic Services. Good morning, Chief.
Good morning. Good morning, Madam Chair, members of committee, and council and guests. Thank you for the opportunity to address some updates this morning for folks. What we're going to provide here is a bit of a high-level update, providing what's going on within the Paramedic Services Division right now, focus on community programs and our PCOP, et cetera, to kind of let you know what's going on, but also just briefly touching on the overall call statistics within paramedic services to update on some of that. People are probably watching the news and seeing the stuff recently posted about the City of Toronto and things like that, and we can address some of those questions if they come forward. So again, you're very familiar with this, I suspect by now, but this outlines what our call stats are, our call priorities 1 through 4 and 8. We're still living in that model. We have not transitioned over to the Medical Dispatch Priority System yet, or MPDS. That will be coming. We're still on the slate to have that happen. It was supposed to happen in the fall of next year. I've been advised we're likely going to be pushed back yet again. It's kind of like pushing a giant boulder uphill, unfortunately. But we're at the mercy of the ministry on this and some of the training challenges and stuff they're experiencing. They are experiencing the same staffing challenges as all emergency and first responders right now with respects to their dispatch centers. So they get folks trained and unfortunately they leave, so they have to train them again. So that's one of the challenges they have, and that's part of the reason for the delay moving MPDS forward. But again, it is going to happen, and I'm cautiously optimistic that it's going to have a huge impact on our ability to serve the community as well. So with respects to call stats, so this basically is January to June of 2023. We responded to 48,025 priority 1 through 4 calls. So those would be your typical, what we would call emergency calls, and 18,803 priority 8. So those are standbys again. So when a crew goes out from an area, so for example, if the Bowmanville crews are both out on a call, we would send a resource over to the Bowmanville area to help ensure that that is balanced coverage throughout the municipality. So that's kind of justifies that number. We are seeing an improvement in our response time, so thank you to this committee as well as members of council for the additional resources put into RDPS, because that is having an impact on our response times. It's a small impact, but you can eat an elephant one bite at a time, and that's what we're working on right now. So we're having a very positive spin on that, and we are seeing a reduction in our overall response time. So we are better serving the public with those response times as well, despite the fact that we still continue to have some challenges with offload delays. They're getting better. We had a little blip a few weeks ago where we had a real problem with it, but the hospital's kind of recovered from that, and we're seeing an improvement again back on our offload delays down to what they were over the past little while. We just completed our provincial review. So the ministry comes in every 3 years and does a full audit of the system. I have not received a report back from the auditor yet. They have 90 days to get that report to you, and typically they take 89. When I get that report back, I'll be able to provide an update to this committee and the chair and CAO with respects to what they reported on. I can tell you that when they left, they were quite happy with the organization as a whole, and they always tend to find a few little minor administrative challenges, shall we say, and we're confident we can address those issues to the satisfaction of the ministry, and there will be no challenges with us moving forward with our license to continue to operate for another 3 years. Like I said, the team was very receptive to the information we provided, and they were very grateful for the work provided by RDPS. They had huge compliments on the staff with respect to their patient care. And kudos to the staff for doing that. And the one thing they had got us on before was what they refer to as a hand washing station. So you have to wash your hands within so many minutes of arriving at the hospital. And that was a challenge they identified in our last review. We provided some additional education to our staff related to that, and we had no complaints at all. In fact, they said this service was the highest hand washing service they'd seen in a long time. So I can probably thank COVID a little bit for that, but I'm going to take a little bit of credit as well for my staff doing the education piece to get that information out. So again, overall, very happy. When I get that finalized report, I'll be able to provide some feedback to this committee. With respects to our community paramedicine program, as you know, we have HISH funding provided by MOH. CPLTC funding is provided essentially by the ministry or ultimately Ontario Health. And then, of course, the regionally funded program is the PCOP program. The total clients in the community programs right now, this was as of September 25th, I believe, 1,509. That we have 117 assigned under the HISH portfolio, 1,199 under the CPLTC, and 193 under the PCOP. Those numbers tend to fluctuate a little bit. We tend to add about 10 a month across the different platforms total, but we tend to lose about 5. So we add 10, lose 5, so we're about a 5 positive on a consistent going forward about every month. Clients onboarded between July 1st and September 25th, you can see we had 5 under HISH, 90 under the CPLTC, and 16 under PCOP. We've been advised by the province we probably have one of the most robust CPLTC programs in the province. That's strongly due to the work of the staff in the background developing this, and they're constantly coming to the municipality and our division looking for direction on what they should provide to some other areas. So that's a positive to the work of the team in the background with this, but we are seeing a real positive spin related to that. I know it's a little bit tough to see, but believe it or not, this is the region kind of grouped in little blurbs at the bottom. So essentially what we're trying to get with this, and it's hard to see, but there are green dots up near, that's kind of Lake Simcoe at the top, essentially in that area. And Lagoon City, if you're familiar with the north. And that's demonstrating some of the homeless population. So it's not isolated down to the 401 corridor and in the south. There is still pockets throughout the north that we're still dealing with the homeless population. And our team are supporting some of these folks as well. We're deployed out of our Sunderland base for our, one of our CP units now, and they're having a real positive impact on the responses within the north. Again, a little tough to see. We have to pull this data from one of our programs, so unfortunately we can't really manipulate the colors a little bit for you to better show you how this pulls out. But essentially these are based on age and client groups. So you can see obviously our largest group is kind of from the 60 on up. That's where our biggest impact. But we do have some even much lower than that area going down through there with respects to the total number of patients in that area. And again, these are focused on the new clients. Interactions between July 1st and September 25th. So the total visits completed by our team was 1,461. That's a huge amount of work for a very small team. We don't have a large team, and they do a fantastic job of getting out there and making sure they're having an impact on this. Patients put on the RDPS remote patient monitoring system. We've added 5 during that time frame. So during that time frame, essentially our staff can log in, view a computer program, and find out essentially the vital signs of the patient. And if they see any abnormalities, they can call or follow up. Or if the patient has a concern, they can hook themselves up, call to our team. Our team can log in without actually physically being on site and get some updates with respect to their vital signs and be able to provide that guidance if necessary, or reach out or send an ambulance or make it a direct visit. They can do all those sorts of things. Clinical notes sent to patient care teams, 522. So again, some of these folks are under direct supervision from other agencies, and our team visits and provides updates to their care team. Point of care blood work, 18 on site. Point of care urinalysis, 22. Wound care, 93. That number continues to grow, and we're having a fantastic response with that. If you may recall from my previous presentation, I showed that slide where we had that one individual with the leg challenges with the need for wound care on his legs, and we had a fabulous outcome with that. So we're continuing to see a lot of demand and push on the wound care, and we're having really successful results with that. Patient care teams consulted, 52, so that's essentially reaching out and consulting to come up with a joint plan for how the patient's going to move forward. CHF patients, that's congestive heart failure, we treated 4, and by us treating those patients, we can keep them out of hospitals and emerges. So that has a big impact as well on not only the emerge department, but the patient. Patients that arrive at a hospital with an exacerbation of a congestive heart failure often get hospitalized for several days. By us being able to treat them and effectively manage them out of hospital, we can keep them out, and therefore they're in a better place. They're at home, they're more comfortable, that sort of thing. We're continuing on with our antipsychotic injections, so our PCOP team, we did 15 during that time frame, and prescription of antibiotics for urinary tract infections, we administered 10 during that time. So that's, again, those are big numbers, and with a small team, we're having a really big impact on that. That's basically it for what we have on the CP side and updates. If you have any questions for me, happy to answer them.
Thank you very much, Chief, and we do. Mayor Foster.
My apologies. Madam Chair, thank you. Chief, thank you. A quick couple of questions. And I guess this would be data-driven, but on slide 3, you were talking about response time improving based on the resources. Based on the resources that you got, did you see an improvement that you expected? So are we aligning, I guess, are we getting the results that we're hoping for out of the increases, budgetary increases?
So through the chair, yes, we're getting exactly what I thought. In fact, we're slightly above. When I did my math, we're about 0.4% above, which may not seem like a lot. And I'm a bit of a numbers geek, for lack of a better term. So I spend a lot of time evaluating the different numbers of response time. So we're kind of exactly in line with where I had anticipated we would be. So I'm quite happy with the additional resources.
That's a wonderful answer. Thank you. If we look at page 7, so you were going through a number, or slide 7, a number of things that you are doing. The better you are at providing services and the more services you provide, the more demand. So the question with that is can we keep up? And I guess it was slide 8, but anyway, it doesn't matter. Not that one either. Don't worry about it. I think you get the gist of the question.
Yeah, so through the chair, it's absolutely starting to stretch the team. You're absolutely correct. One of the things we have looked at is there a need to put additional resources in the team? What we've done instead, because to be honest, we can't afford to lose the resources full-time off our 911 side. So what we have done is we've trained additional 911 response paramedics for the ability to do that. So if we have an absenteeism or something on our CP side, we're able to transition a person over to cover that vacancy. So we're actually minimizing the vacancies on our CP program by having trained additional folks for the necessary skills and then utilizing them when necessary to cover that off. Much like we try to cover vacancies on our 911 side, if a paramedic books off, we now have folks with that same skill set we can move over there. Could we use additional resources? Probably we could, but right now we don't have capacity within our organization to add on the CP side at this time.
Okay, thank you. And last question. We had a chat. We've heard this from Durham Region Police on a regular basis. Durham Region Not-for-Profit Housing. There are a couple of residents, I'll describe them as, and not to denigrate anyone, but as a frequent flyer. So a significant amount of resources go to a very small part of the population, and likely people that are incapable of taking care of themselves and incapable of living independently. Do you have stats that would support that? And we're looking at talking with the province, talking with a variety of province, federal government to make sure that we aren't spending an inordinate amount of resources on people that, quite frankly, shouldn't be our clients. So
yes,
I'm guessing. Sorry, go ahead.
Sorry, I was through the chair. So again, to answer your question, yes, we have that subset of clients as well. But what we're seeing, though, is by the visitations of our CP team and the PCOP team and that sort of stuff, we're actually seeing a reduction of our responses to those folks. So as a number with that small subset of people, we've reduced their 911 responses actually by about 30%. It's a small subset, so the overall number in the grand scheme of things isn't that large. However, that is a big number when you extrapolate it across the entire organization. Now, I can't speak for police because, again, we manage things a little bit differently. So we're managing often the health side and some of the mental health challenges as best we can, but that doesn't mean that it doesn't end up generating a police response to some of these calls. So that could still be impacting them, but we're seeing a reduction the other way.
Okay, so that's good news. At some point, we'll probably be leaning on you to provide some statistics as we try to grapple with the issue. Thank you, Chief. Madam Chair, thank you. To the clerk, I was pushing the vote button, so I don't know if I voted that I'm here or not, but I'm here. Thank you.
Thank you, Mayor Foster. Councillor Jebb.
Thank you, Madam Chair, and through you to the Chief. Thanks for the presentation, Chief, and of course to your team, the good work as always. I just wanted to acknowledge that you are correct. The CP units up north, I have seen them quite often. I had to look twice. I haven't seen one before, so to see they're different looking vehicle, but I have seen them multiple times, which is good to see, but of course bad to see as well. With that said, last week we had the police chief in, and he showed specific data for response times in the region, and he broke it down to each specific lower tier municipalities. That showed some alarming results that led to some questioning to the chief, and the chief actually acknowledged that resources are going to be put to those areas that we've actually seen response times go up. And I'm a little worried that might be happening with the paramedic services. That said, for our next update, can we include something just like that to show our lower tier municipality statistics to see where we're winning and where we might be actually needing some more resources?
Through the chair, absolutely, we can break that down. I break it down per lower tier municipality on a regular basis anyway, so it's no problem at all to provide that.
Thanks, Chief. And are you seeing, just because I don't see it here today, are you seeing some municipalities that are seeing decreased response times, or are we going in the positive all across the board on all 8 municipalities?
So again, through the chair, most of our lower tiers are seeing an improvement. The improvement varies depending on geography. So to your point, in the north, I might see a 4-second improvement as an arbitrary number, yet in the south, I may see a 35-second improvement because, again, more resources are down here, the geography is tighter. But any improvement is a positive improvement in my mind. So we are tending to see that continued improvement as a generic statement. There are going to be days and there are going to be times when there are some add-ons, but when you average it across the entire, we are tending to see a little bit of an improvement across all lower tiers.
Okay, that's good news. And as we know, we only have one taxpayer. All Durham residents pay the same tax. We should have the same service if we look at it that way. That's obviously the goal we're trying to get to. In that data, are we including our neighboring municipalities that come in to assist when we can't get there within the prescribed time?
So through the chair, I can access that data. I don't always include it. What I will have is a subset of calls. I'll say, for example, if we responded to, let's say we responded to 100 calls in the north. I'm just, again, arbitrarily picking a number. 4 were responded to by another agency. I will only report on the 96 and the 4 will stand alone. So I will not report on those response times from the 4. I'll simply say 96 were responded to by Durham, 4 were responded by another agency. And then you will know that another agency responded, but I don't have access to their response times.
Okay, and that's definitely a gap because I always use York and Simcoe County because I see them quite often here. So how do we find out if our units, if our buses stay south of Port Perry, how do we find out how long a patient is waiting if Simcoe or York is coming to that call?
So through the chair, because we don't deal with the same dispatch center, I would have to reach out directly to the different chiefs in those areas. I could tell you if it was deferred by us. So for example, if it was, I'm just, again, picking something, a sore thumb. And a sore thumb would be a priority 3 response. We already have the ability to defer that for 60 minutes within our current directives from the province. So if we don't have a resource readily available to respond to that within that 60 minutes, we'll defer it and we'll try to get there. And what will happen is dispatch will call that person and say, has anything changed? The ambulance is still in the queue to come to you, but has anything changed? At the 60-minute mark, at 61 minutes, we will transfer that call over to Simcoe or York, depending on where it is, and they will assign a unit to it. That being said, if they're in the same circumstance, they will notify us that we're in code 3 delay status as well, so you need to take the call back. So we would absorb the call back in, and then I could track that. But I can certainly reach out to our neighboring chiefs and get any data specifically to our area. I can tell you, in speaking with York, I speak with the York chief quite regularly. They've seen a huge improvement since our additional resources with having to do calls within our municipality. They're unfortunately getting brought into other municipalities, but they've seen a huge improvement with any of the need to come into our area. Between that and our reduction in offload, we have resources available on an almost consistent basis now.
Okay, that's good news. I am looking forward to the additional data for the next update. And again, thanks very much for the team, Chief. Thank you, Madam Chair.
Thank you, Councillor. Councillor Anderson.
Thank you. Thank you, Chair. Thank you, Chief, for being here. I didn't see the numbers of the percentage of calls, the 48,000 or whatever. What percentage of that would be associated with mental health? And if so, and it's clearly defined that it's a mental health issue, do you still go to a hospital or do you go to Ontario Shores? How does that work?
So through the chair, you're correct, I didn't break out the exact number. And the challenge with that is there's only so many ways you can code a call within our patient care software. So despite the fact it could be a mental health challenge, it may be coded as, I'm going to say chest pain. So somebody could be having an anxiety attack and the call comes in as a chest pain, but when the crew gets there, they determine that it's an anxiety issue, which ties back to a mental health issue, which really isn't a chest pain. So sometimes it's very difficult to get some accurate numbers related to that, but I can do a deeper dive and provide some information for the ones that we know are the mental health calls and provide that to you. To answer your question about Ontario Shores, no, we do not transport directly to Ontario Shores as of yet. We are working closely with the province and with Ontario Shores to try to develop an alternative destination strategy. But as of right now, Ontario Shores doesn't have capacity to deal with what we would determine as an emergency mental health patient. So we're hoping we can get that sooner than later. But as of right now, no, we are not. We're transporting to essentially a local emerge departments.
Yeah, I think that would be very helpful. I think for you, take the burden off the hospitals to a point, and also the patients would get the treatment they need more expeditiously. So yes, so that's something that should be looked at seriously, to be quite honest. Thank you.
Thank you, Councillor. Chair Henry.
Thank you, Chair. Chief, just a quick question to follow up on Councillor Jubb's question. So are our services doing calls outside of Durham Region now?
Through the chair, absolutely we do.
And are I've never seen statistics or numbers telling me that it's all under a giant mutual aid type program. I don't think council's ever been given those numbers of the communities that we're doing cross-regional service in. I think that would be important for us to know as well.
Through the chair, absolutely, I can pull that information out and provide it to you. Our numbers are dramatically lower than what they used to be, I can tell you. But as an example, Northumberland County, we used to dip into Northumberland County quite a bit because their station was in Port Hope. And we had our Bowmanville station, which could actually get to some of the calls, especially if you look at the 401 as a great example. If it's an eastbound 401 call, we can certainly get there quicker than Port Hope, who has to drive past the call, turn around, and come back. So that's one example of an area where we do that. But I can certainly pull that data as to calls we responded to in other municipalities, but it's not as big as it used to be. And to your point, yes, we essentially have, there is no formalized mutual aid agreement like there is with lower tier fires. Essentially, it's just it's a given within the dispatch system. They can just transfer the call over to the next dispatch center. So, and that agency responds. So there's no cross charging as of right now related to those things. It has been brought up before, but it's never come to fruition.
Yeah, I'm not so much concerned about the cross charging. I just want, the public to understand that the interaction of all services together make a better health care system, and I think we need to know that. A follow-up question to something that Mayor Foster said. On the number of people that are repetitive, that you deal with on a regular day, and sometimes multiple times on the same day, that are then transported to the hospital and then returned to the building to go through that cycle. There are a few in Durham Region, and that is a challenge. Through your association, are you addressing that with the province to try to figure out a way to deal with people that are having challenges? Simply taking them out of their unit, dropping them off at a hospital for a couple of days, the hospital says, you're okay to go home, and on the same day that they're dropped off by a delivery service of some type, and then we've got units back at the same unit on the same day. That's becoming a challenge.
Yeah, so again, through the chair, you're absolutely correct, and the province's solution, shall we say, for this is the CP programs, and hopefully the continued growth of the CP programs, which again should be funded because of this lives under primary care in my world, and it should be continued to be funded by. Is there enough resources? There isn't right now, but you're absolutely right. That is an ongoing problem. Our association does bring this up regularly with the province. We meet with the ADM bi-weekly now, and we do address some of those challenges. But there's no, I don't believe there's a simple fix, unfortunately. Some of those people will continue to be challenges.
So follow-up question. And eventually you're going to probably understand and identify the building I'm talking about, but we won't talk about it in public. When does it become, who finally makes the decision that this individual is a hazard to themselves and a hazard to the community? And what happens next?
So through the chair, ultimately the decision has to come from a physician. A physician would have to designate that person incapable of caring for themselves, and then therefore essentially provide a court order, for lack of a better term. There's another form they fill out that would then say the patient cannot look after themselves, and then they are essentially admitted based on that rationale. It's really tough to get that, as you well know, human rights and all the other challenges that live with that. It's very tough to demonstrate that, but in the one building I believe we're speaking of, we're developing a solution right now, partnering with Lakeridge Health. We haven't got this finalized yet, but they applied for a grant to allow to work collaboratively with our CP team to actually attend with our bus that we now have on our CP side, with a prescriber on board and a member from our social services team, as well as a member from our PCOP team, to allow people to come just down the stairs and walk right into the bus and get the same essential service they would get, to your point, at the hospital for whatever challenge they're dealing with. So we're hoping that, in addition to some of the other things we're doing, is going to start alleviating some of the pressures for those folks and maybe give the physicians a better insight as to how these folks are actually living, because the opportunity may be for them to wander upstairs with them or wander into their apartment with them and actually see how they are, because it has to be a full picture for the physician to best make the decision on how to manage these patients. And as you know, as paramedics, we go into these residents, see them, and we often see very challenging residents. However, when you get to the hospital, the patient can present a much nicer picture than actually is really happening in the background. And it's very hard for the physician to make a ruling when they don't have that other piece of evidence. So this added piece, I think, may help alleviate some of those pressures in some of those areas, but we'll have to wait and see what happens with it.
Final question, Chair. And I appreciate the answers, and I think we're on the wrong building, so we've got more than one problem. So that's, but the cost of this is in the hundreds of thousands of dollars for one individual. And the municipal level of government doesn't have the tools to deal with the complex issue that they're having, and the complex health issue they're having on top of all this, and the addiction problem they're having. There must be a way when this individual or individuals, because there's more than one in the region, we've identified that now, go through the revolving door of the hospital. When does the emergency room physicians, because they have the file, it's up in front of them, it all is identifiable by their OHIP card. When does somebody finally make that decision that the money that we're spending on outside care is far greater than the cost of the care that could be provided at Ontario Shores? And you might not be able to answer that, but there's got to be a better way to manage this, because I've got a message now that one of our emergency services is contemplating not addressing this address anymore and leaving it, taking that one service out of the picture and leaving it with the other services because the demands on their services are so great. And of course, they can't do that. They still have to respond. That's the rule. But it is frustrating, and it's frustrating in that we're not able to do any more than what we're doing, and this is not the cure.
Yes, through the chair. So you're right. I don't have a perfect answer for that. I can tell you the system is the system, unfortunately. And actually, I was sitting on a meeting yesterday with, again, with the ADM, and we were talking about the system as a whole and how, for lack of a better term, it's broken. And this isn't new either. People are thinking that, these are new challenges that healthcare is being, proposed with. However, I've been in this business 33 years, and it hasn't really, they've changed the name of the different programs, but the system has still remained the same. So you're absolutely right. It's where do the physicians deal with this? The problem I see with some emerge departments is, you're absolutely correct, emerge physicians have the ability to look up the total chart on the patient, but they don't always do that because there's one piece of paper that lives on the chart for the patient and they deal with them in real time at that moment. And unless they get an update that here is, Troy coming back again, they may not know, because we're running into the same challenge with staffing the emerge with physicians, where there's a whole group of new physicians coming on board now. So they haven't really established that information piece.
So I'm sorry, Chair, follow-up question then. So then why aren't we, or maybe we do this, do we not collect all that data because we're dealing with the same person at the same time and all the incidents collectively between fire, police, and EMS? And can't we bundle that and take it and hand it to the emergency room doctor and say, we need to find a way? Or can't can we as an organization follow up afterwards with the chief of emergency services at that particular hospital and say, look, we need to sit down and we need to have this conversation and find a way so that we can help more people, but our emergency services people, when they're dealing with this one individual, so often, and they're taken away, and when you talk about delay times, this individual is taken away from the ability to deal with serious issues, from car accidents to heart attacks, and it just breaks my heart that the repetitiveness and the cost of this, and there is no light in this tunnel at all, and there has to be a better way. Then on top of that, you'll get a message from me sometime today or tomorrow on this very topic to have this conversation, but it will be with all the emergency services involved.
Yeah, so through the chair, I completely agree with your statements. I don't know that there's an easy fix to this. To your point, we have to get the province on board to try to lead this, because there are some other legal challenges that we would be posed with. We can't, to your point, withhold services. However, that being said, we also recognize that this does put added pressure on the system. What we've started doing with some individuals, if they call 911 for an emergency call, a priority 4, because they may report it as shortness of breath, as an example, and we get there and we find out there's nothing related to that, we will advise them we're going to have to come back and deal with them later, and we free up our resource at the time, and they'll usually sign off. Some people we have clients that we've seen 50 times in a 30-day period. It's not unusual to see some that many, and we have had, like I said, a very positive impact on the CP side on a small subset of that group. But I don't know that there's an easy solution, unfortunately. But happy to have the conversation and work together to come up with something.
Thank you, Chair.
Thank you very much, Mr. Chair. Is there anybody online who has any questions? Seeing none, Chief, just in response to the community paramedic program, and the last time that you presented to us, you spoke about the how community members, the potential is that the uptake of having the paramedic care versus the actual medical care. How has the referrals of that 90, and I know you spoke about the proactive approach, but where are we getting the referrals from for community paramedics for clients?
So basically the referrals come from the home care agencies and that sort of thing. The one challenge we have seen is what's happening is sometimes, unfortunately, Friday afternoon at 5 o'clock, we get a phone call saying, by the way, you need to look after these 3 patients this weekend because we don't have the staffing to manage it. So we're being you know, for the weekend, we'll have those 3 patients we got to deal with, and then Monday they're ready to take them on again. But a lot of our referrals come through that. We've received some referrals through our different hubs and different agencies like that, but the bulk of them come through different agencies that provide care to some of these folks on the CPLTC side.
Okay, and speaking with the ADM about the supports and the requirements for supporting community paramedics, has there been any comparison to what they've been doing with with pharmacists and the increasing of their ability and what they're being funded now? So the pharmacist just recently received, I think it was like 3 to 6 more ailments that they could prescribe for. Is there comparison in that type of care for the paramedics to have the same type of funding?
Yes, so what's happening right now is the entire Ambulance Act is being revised and being brought forward to the House with respect to some changes that will specifically identify some rules and guidelines for CP, or community paramedicine, and they're going to look at potentially adding that scope or whatever skill set lives within that. As of right now, it's not there, so it's kind of whatever your physician will delegate to you to allow you to do, you can do. Which is why we do some of the antipsychotics, we can do some of the wound care, that sort of stuff. But that is something the province is working on developing right now, and it'll be rolled out provincially as this mandate. So CP will ultimately become a subdivision of paramedic services. So you'll have your 911 response and you'll have your community paramedicine division as well.
Okay, and I have one specific question, my last question, and it's somewhat of a continuation from what Chair Henry was asking, but it's in the context is that we have a seniors building in downtown Whitby, and they have been trying to get support and care within that building. Is this something that a type of program, and I know the paramedics do actually attend to individuals within the building, but the overall of a drop-in service, is that something that could potentially come into play in the future for areas that we know that there's more needs and supports on a proactive approach, not on a reactive approach?
So we'd have to look at the individual area you're speaking of and the individuals, because right now the mandate under the provincial funding model is the patients have to meet a certain age criteria. If they don't meet that age criteria, they don't fall within our funding envelope, and we're not really supposed to support them on that side. That being said, we can certainly have a conversation. You can have perhaps somebody from your team or whatever reach out to Commander Jordison, who looks after our CP program, and he can kind of work with you to develop, is there a solution we can create for a potential drop-in? And even if we set it up, and I'm speaking on behalf of Jeff, so he'll kick me later, but even if we set up an opportunity that perhaps on, I'm arbitrarily picking a day, Wednesdays between 9 and 11, we could have somebody at the building that if somebody wants to speak to them or ask them direction or provide some follow-up, maybe that's something we could look at. Again, we're quite busy with the number of resources we have, but anything we can do to mitigate any of those 911 responses or address some of those challenges and keep the folks out of eMERGE, keep the folks out of the clinics, that all benefits them as well as the system as well. So absolutely, you can have that conversation with Commander Jordison, and we'll see where that goes.
Yeah, and I will have that conversation, because I think that collectively with this residents group, and I know Chair Henry, I think you know who I'm talking about, that they are pushing forward for paying for their own nurse to come in as well too. So I think that there's something that we could look at doing together. All right, and thank you very much. We have no more questions, and I'm going to move forward, and thanks to all the paramedics for all they do for our community.
Thank you.
We have delegations next. We have a motion to include 4 more delegations that came after the publication of the agenda. And can I have can we put the motion up, or do we need to put the motion up? Oh, we don't need to. Okay. Can I have a mover? Chair Henry, seconded. Councillor Anderson. And I'm going to ask those opposed, because there's members that are on a line. Is there any opposed? Hearing none, I'm going to proceed forward, and I'm going to start with 6.1. I also will identify that 6.5 in our agenda, which is Mr. Hartley, has removed his presentation, so he will not be presenting. I'm going to call 6.1, and this is Lisa McNee Baker. She's the Executive Director of Community Living, Ajax, Pickering, and Whitby, and Mark Grant. Good morning, Lisa.
Lisa, if you can hit your request to speak button. And Mark as well.
Okay, I think I've got it.
Yeah, we got you.
Can you hear me?
Is
Great.
Mark with you?
All
Yes, he
right.
is. There he is.
Yes,
Perfect.
he is.
Perfect. Thank
Great.
you.
All
Go
right.
ahead.
Perfect. Good morning, everyone. Thank you for allowing our delegation to present to you today. My name is Mark Grant. You may recall that I'm the manager of the Adult Protective Services Program, and my co-presenter is Lisa McNeed Baker, who is the executive director of Community Living Ajax, Pickering, and Whitby. You may recall that I presented at the last Health and Social Services Committee meeting in September about the region's Adult Protective Service Program, which is part of the Department of Social Services, the Family Services Division. And you may recall that an important part of the Adult Protective Service Program is advocacy, both on an individual level for the clients who we support and on systems level, advocating for the growth of needed community services for people with developmental disabilities in Durham Region. And that systemic advocacy is why we're here today. And we represent a committee of leaders of developmental service organizations in Durham Region called the Durham Systems Management Committee. I'm the co-chair of the committee, and Lisa is the chair of a subcommittee that focuses specifically on housing issues related to people with developmental disabilities. And Lisa will provide more information on the role of this committee. Next slide.
Thanks, Mark. So as Mark mentioned, this is a large committee. There's representatives from about 24 different agencies that provide services to people that have intellectual disabilities. A lot of our work is strategic in nature. We're looking at what are the trends, what's happening in the community, and we do have an annual work plan that we address. Some of the things that we've been working on would include response to COVID and emergency preparedness. We're looking at diversity, equity, inclusion. Like many people, we're having challenges around staffing, recruitment, retention. It's a real issue in our sector. We're looking at system transformation. We do have plans in place from our funder, the Ministry of Children, Community and Social Services, to completely change how we've been delivering services. And of course, as Mark mentioned, housing is something that we've been looking at. I chair a subcommittee that looks at ways to help people access supportive housing. And that's really what we're here to talk a little bit about today. Next slide, please.
So one of the things we do is we look at data and review the data and use that data to inform and support the services for our vulnerable clients. For example, not many people are aware that despite people with a developmental disability making up only 2% of the population, they make up 18% of people living in shelters. That's almost 1 in 5 people in a shelter, which is an exponential overrepresentation of this marginalized group. Other significant stats that speak to the disproportionate representation include 50% of people with developmental disabilities have significant medical issues. Women with a developmental disability are 65% more likely to experience abuse than those without this type of a disability. 90% of people with a developmental disability live below the poverty line. And 40% of the 100,000 Ontario adults with an intellectual disability, and this term is used interchangeably with developmental disability depending on the researcher, has a concurrent mental health diagnosis. And finally, most relevant to our presentation today, about 14,000 Ontario individuals with an intellectual disability are on a waiting list for residential housing with a projected 40-year waiting list. Next slide.
So this slide gives you a little bit of information of what the situation is in our sector. So this is data that was provided to us from what we call the DSO, or the Developmental Services Ontario. This is a central intake portal for people that are seeking services around adults living with developmental disabilities. So the first service type listed is a group home. And this, I just want to be clear, this is Durham statistics, not Ontario-wide. So for group homes in Durham Region in the 22-23 fiscal year, there was 23 resources declared, but there's 1,369 people waiting for that type of service. And to be very blunt, typically the way that resources are declared in group homes is when somebody passes away. So people come into service and they stay, they age in place. We don't send them off to nursing homes or anything like that. They stay with us until they die. Sometimes people transition out of group homes to go into supported independent living, which is the next program that's on the slide. In Durham Region, 18 supported independent living resources were declared for the 852 people waiting. And this is a scenario where a person would be living in typically an apartment, and they would get about 6 hours of support a week from a paid staff member. The associate family model is a really intriguing program. It's like a host where a family welcomes a person with a disability into their home. They receive a stipend to provide care and probably some room and board. 2 of those vacancies declared for 330 people waiting. Individual housing support would be where a person's looking to develop a plan around housings. They may have housing, they may be having housing left to them. There was no resources declared for that for the 494 people waiting. Community participation support is typically our day services. This is an area that was really impacted by the pandemic. We had services completely shut down during the height of the pandemic. There was 28 resources declared for 1,861 people waiting. And for respite, so to give families a break, 28 resources, 1,572 people waiting. One of the trends that we're seeing, we actually manage the urgent response program at our agency. And one of the things that we're seeing is many of the people that are coming into care and many of the people who are being referred to urgent response are people that are on the verge of being homeless or are already homeless. We're also seeing a lot of referrals around caregiver burnout. And just when I think about our own agency, Community Living Ajax Pickering Whitby, the last 6 or 7 people that we took into service were people that were homeless. So they may have been in shelters, they may have been couch surfing, or we had one person who was run evicted and living in a motel. So this is the type of trend that we're seeing, certainly people with more complex issues. I can think of one person that we're working with right now who is has an intellectual disability, has pretty significant physical challenges, and is currently living in a van. So these are the types of things that our system's trying to respond to right now. And one of the big challenges as well is for young people that are coming up through the school system. So they're finished school and there's nowhere for them to go. There's no services. And parents often have to make the hard decision for one of the parents to leave the workforce. So significant financial impact. They're no longer paying into pensions, a real hardship and a loss to the community that we don't have people in the workforce so that they can care with their loved one. Next slide, please.
Therefore, we know the supported housing needs of people with developmental disabilities are not being met. What we're asking for today is for the region of Durham to improve the availability and affordability of housing for individuals with developmental disabilities. This can involve partnerships with the federal government through the co-investment fund to reflect current day costs for housing and establish a dedicated pathway for deeply affordable and supportive housing for the developmental services sector. Also, partnering with the provincial government and investments in housing for people with developmental disabilities by earmarking 10% of the National Housing Strategy funding to this critical need and demonstrating a commitment from the region of Durham to commit to this goal. A potential action would be for the region of Durham to write to the federal and provincial governments regarding these partnerships. Next slide.
Thanks, Mark. And we do know that the region's been doing a lot of advocacy around this housing crisis, the issue of homelessness, and we appreciate that. We just want to share the message that we want to partner with you. We think that we have something to offer. For example, with some of the loosening of some of the zoning bylaws, there's a number of us that have decent sized properties where we could consider micro homes on our properties. Some of us have good properties close to service where we could build up. So we want to work with the region and participate in any way to help move this forward. Our advocacy work isn't just at the municipal level as well. We're also reaching out to our MPPs to share the message around some of the challenges that we're facing in our sector. Next slide.
Thanks, Lisa. And just to reiterate what Lisa said there, we're not just here asking for something. We're here today to be active partners in addressing this dire need for the vulnerable citizens who we support. So here's our contact information. Please reach out to us to discuss opportunities to provide deeply affordable housing to individuals with developmental disabilities living in Durham Region. And once again, thank you for allowing us time to present to you today.
Thank you, Mark and Lisa, and I have Mayor Foster.
Let me try that and see if I can still hear everything. So just a couple of questions. The stats that you showed in terms of the waiting list, are those reflected in the numbers that we see already on the way on I'm going to say our traditional waiting list, so not focused on developmentally disabled individuals?
So those are people that are seeking supports through Developmental Services Ontario. So those are people with intellectual disabilities that are looking for supports from our agencies. And typically what they're looking for is accommodation supports. So, I mean, there's some people who just want daytime supports, but we're seeing a significant number of people who want accommodation supports.
So I guess what I'm trying to get at is we see a list of housing needs, people that are looking for housing. Is this in addition to, or is this, are we already seeing it? I guess I'm trying to, gather the magnitude of the issue.
Well, some of the people that are on the DSO list will be on municipal housing lists as well. And certainly the people that we work with, we tell them to get your name on that list because we understand there's a wait there as well. But many of these people are seeking accommodation supports and just supports to help them manage their lives. A group home typically would provide a person with 24-hour staffing. So they have people supporting them around the clock.
Okay, and I mean, the challenge that we've got, I'm going to turn my video off. I don't know if that background noise, are you hearing that as well? So maybe it's, I don't know if that's going to help or not. I'm still here. It didn't help. So Mark, your plaintiff plea, and it's a valid plea to please work together, seems a little bit odd given that you're already one of us, if you will. So how do we, are there silos that we need to break down? And an obvious perhaps question is, if we're looking at the not-for-profits, Durham Region Not-for-Profit is now working with Habitat. That's a wonderful partnership. I don't know if that can be expanded. Having said that, we are nowhere near to being able to satisfy our own needs. I mean, the problem is far greater. So Mark, how does better integration, more dialogue happen?
Well, one example could be something that we've been looking at just recently with respect to the Beaverton Transitional Home and so on. So the region has actually been quite generous in coming to us and saying that offering, they can allocate up to 10 of those beds for developmental services and providing the housing, the food, and support and so on. However, when we kind of take the proposal for some additional case management to the Ministry of Community and Social Services, and the case management is critical in providing that wraparound approach for ensuring that these individuals don't become bed blockers, for lack of a better term, and also to help them transition back into their own communities. Connecting them to the resources, whether it be medical or legal or employment or whatever the case is. Without that kind of that case management piece, it just won't be successful. So the only thing we're asking for the Ministry of Community and Social Services for is to provide that intensive case management. However, the response that we get back is there's no new funding that's available through the ministry. So that's one example of maybe kind of intergovernmental kind of communications. And we are going to be moving that forward, having some more communication between the ministry program supervisors and organization. But it's kind of that example of working better together at that different levels, tiers of government.
So let me flip it another way, and this is hugely problematic where the money doesn't exist or is not forthcoming frequently from the feds, the province, to deal with this massive issue that you are part of. So Mark, who do we, in a perfect world, Mark and Lisa, who do we bring to the table? So the request is, can we please get and talk, sit together and talk? And again, Mark, given your role in our organization, who would you like to see? And if you want to think about that and get back to us, please do. But we should be able to facilitate discussion fairly easily, I would think.
We just wanted to stress if there are any committees or working groups looking at housing, we'd like to be included in those conversations. Because as I said, some of us have properties that we think could be utilized for micro homes or building up, garden suites, that type of thing, to address that 18% of people who are unsheltered who have intellectual disabilities.
So Lisa, I'll make the offer. So I can tell you that Durham Region Not-for-Profit is looking at significantly expanding what they're doing, intensifying what they already have, but looking at new projects as well. So if you want to reach out, we can have that dialogue. I don't know what the capacity of the organization is right now, but I'd be delighted to. That's a little piece that we can facilitate. Thank you, Madam Chair. Thank you.
Thank you, Mary Foster. Commissioner, can you give a comment about working partnerships?
Thank you, through the chair. So Mark and I have had discussions around the Adult Protective Services program and work that we're looking to do at Beaverton. We are looking to further take this conversation to the Ministry of Children's Community Social Services for advocacy for this particular program, to provide the case management that we need to keep these folks who we want to see housed in this building, and to have a sort of a proper existence when staying with us. So we will be advocating if this doesn't happen. We also know that there's opportunities through some of our other projects. We have our Durham Regional Local Housing Corporation revitalization that's currently happening. Yes, it will take some time, but we will have opportunities to expand the housing in those areas. We have Ritson Road as well that we're just now going through the consultation process and looking to create some housing on that property. And we have 1635, which is a great opportunity to partner and see how we can further support this particular population.
Any further questions? Online? I do have a question just with relation to your partnership with Habitat for Humanity. Has there been any Habitat partnerships in the Durham region?
With our sector specifically, not yet, but they're on our radar to connect with and to bring forward to talk about some of the issues that we're facing.
Okay, I appreciate that. All right, seeing no more questions, thank you, Lisa and Mark, for your presentation, and looking forward, please reach out to Mayor Foster as well, and talking further with our staff. Thank you very much.
Thanks very much.
Thanks very much.
Moving on to 6.2, Mike Lufkins. Mike, you're here.
Good morning, Council.
Good morning.
Before you start the clock on my 5 minutes, I'd love to just show you a picture here. And I'm showing you this for a reason. So you probably may not be able to see that. Okay, so that is some of the refugees from Nigeria and Ghana living on the streets last night in Toronto, unfortunately. And I show you that because at 10 o'clock last night, I'm on the phone with some of the community leaders trying to come up with a resolution. And in my 35 years as a first responder, I've been in and out of homeless shelters, men's and women's. So I tell you that because I'm going to present with some compassion towards people without homes. I have some compassion here, but I would like to just share some other things. So let me just see that it's okay. Great. Your plan for a low barrier shelter in Whitby is fundamentally flawed. According to Elaine Baxter-Traher, our CAO, the shelter cannot be capped at 45 residents, 45 residents, and this number could be expanded when circumstances, when circumstances require it. Assuming when circumstances require it means an extreme cold January night, I asked her how many homeless beyond the 45 capacity occasionally will occupy 1635. She said she didn't know. They were still formulating a plan. This clearly infers to me that at times there may be more. Given the size of 1635, we must assume that it could be anywhere from 1 more to 200 more. So this begs the question, what happens when the weather warms up? Does the shelter return to the 45 limit? And what happens to the 1 or a couple of hundred homeless people that are put out into the street? Mayor Roy, if you think you have a problem with the alleged 16 encampments currently in Whitby, this will become a bigger burden than you can imagine. Describing the homeless issue as a burden is not my choice of words. In an email from Ward 4 Oshawa Councillor Rick Kerr, why should Oshawa carry all this burden? Before long, Elizabeth, it's going to be your burden. Seeing that the councillors and mayors from Pickering, Scugog, Uxbridge, Brock, Clarington have unanimously endorsed this plan, I'm certain they'd be happy to move forward with proposals to find shelters in their residential neighborhoods to help ease your impending burden. I'm told this shelter is going to be different. It will have all the wraparound services required to support all the homeless Whitby, the homeless under one roof. Does that not concern you, Mayor Roy? It should, because according to Mayor Dan Carter, putting most of the services for vulnerable people in one place, a strip of downtown Oshawa, was a mistake that drew predators and worsened the disorder in the streets. To combat this burden, Oshawa will be spending $2.5 million annually on additional neighborhood security. Whitby and the other members of Durham Region are supporting Oshawa's neighborhood security to the tune of $500,000. So while Whitby residents help to pay for Oshawa's neighbor security, Whitby gets zero financial help to ensure the safety and security of their neighborhood adjacent to this property. As one of your representatives said to me on August 30th, that's what 911 is for. Throughout North America, the homeless crisis continues to escalate despite over 200 American cities and dozens of Canadian cities implementing their 10-year plan to end homelessness. Many of these plans implemented well over 10 years ago. That includes Durham Region implementing their 10-year plan to end homelessness in 2014. Perhaps the single biggest explanation to the lack of success to these programs is a lack of funding. So how is Durham going to pay for the ongoing operational expenses of this facility with wraparound services? Are we going to hit the taxpayers once again? While our hardworking citizens are struggling under the rising costs of fuel, food, housing, and other living expenses, you have decided to further burden them with an almost 10% property tax increase. Are you trying to help homelessness or trying to create it? Going forward, there's little evidence to support the idea that Durham has the funds to support the shelter without the long-term financial support of the federal and provincial governments. With the lack of funding, how can you possibly sustain the never-ending operational costs of running this low-barrier shelter? Chair Henry himself has been vocal not only about Durham's lack of funds, but also the lack of financial support from upper-level government. Crickets, I think is what he said. So much so that he is quoted as saying, "I'm worried about my kids. I'm petrified about my grandchildren and what they're about to inherit." Should we not be worried about the children and grandchildren around this shelter or right next door? It's entirely possible that future government budgets at all levels will get squeezed to the point of spending cuts. The potential fallout for a shelter that lacks ongoing financial support is likely to be significant. We don't need to look any further than what's happened in Toronto to see our potential future problems. In 2021, they averaged 368 violent incidents per month in their shelters.
Mike, do you have much more?
Pardon me?
Do you have much more? Your time is up.
That's it?
Yeah, 5 minutes.
Wow. Okay.
Were you not told that?
Sorry?
Were you not told that it was 5
Yeah,
minutes per
yeah.
person? Okay.
I actually practiced it this morning, and I had 4 minutes and 50 seconds, so I thought, okay, well, yeah.
Do you have much more?
Sorry?
Do you have much more?
I have much more.
Do
Oh, no.
you have
No,
much more?
no, I'm almost done. I'm near the end.
Okay, please go ahead and finish.
Okay. It's entirely possible that future government budgets at all levels get squeezed to the point of spending cuts. I'll go to Toronto's figures. From 2016 to 2021, Toronto recorded 11,677 violent incidents in their shelters. Those figures do not include the increased crime in adjacent neighborhoods. As a Whitby resident that donates an enormous amount of time helping marginalized communities and clearly sees the need for community shelters and affordable housing, it disappoints me to see that the best you can come up with is this plan that ignores the concerns of neighborhood residents with no real long-term sustainable financial plan. We all want the best for our citizens, the homeless, and emphasize the neighborhood residents. Thank you.
Thank you very much. Is there any questions to the delegate? Online? Councillor Yamada.
Thank you, Mike. And thank you for coming in and for your 35 years of service. That's a testament to who you are and how much you value the community. Now, what would you have done differently with respects to the shelter plan?
I do have some thoughts on what should be done differently. I think first and foremost, a lot of your decisions are based on data and stats that you're given. And as Mark Twain once said, there are three types of lies. There are lies, there are damn lies, and there are statistics. And that's not to say all statistics are lies, but understand it. And a good example of this is, say, the University of British Columbia had a study not long ago where they gave homeless people, the homeless, in their mind, they gave them $7,500, 50 of them, $7,500. And then they stated that, wow, when you give them something, look at what they did. They put the money in the bank, and they actually became less of a problem for the community, and da-da-da-da-da. Now, we know that a lot of the homeless, I've been told, have mental issues and substance abuse issues, and there are some chronic homelessness. What's interesting with that study, they didn't include any of those. So how can we make a broad statement about something when we don't drill down and look at the data? I think that's a problem. I think the second part of that would be to know the crime potential. Don't disregard it. In Portland, and I've mentioned it before, in Portland, they stopped arresting for petty crime, minor crimes, and some assaults and some verbal abuse because they didn't have the resources to deal with it. So sometimes we're hearing, oh, the crime hasn't gone up. In fact, the other day, we heard crime only went up marginally beyond 400 meters. Well, what about the people within the 400 meters? And I think probably the most important thing, and this is where I think it's important for council, when the residents are speaking, to open your ears and listen. They are concerned about security in the neighborhood because that does happen. We know what happens. I've been in men's shelters and I've been in women's shelters. And I know, well, this is another one that I believe it was our author and consultant, Ian DeJong, said when we asked him, is there a comparable size shelter anywhere in Canada? And that was successful. And he said Stella Circle in St. John's, Newfoundland. That is a women's shelter, and they are different because I've been in them. They're far less violent. Women are far more organized, and they seem a lot more compassionate. But the men's shelter is different. And so if we're opening this up to anybody without barriers or low barriers, you need to look further than 2 weeks ago, when Rebecca Craig spoke about her brother, who's schizophrenic, who has 20 convictions, who has been banned from 5 shelters, but he's allowed in 1635. And now what's happened the next day? He gets booed out because we don't allow violence in there, but you don't look at his background. That, to me, creates a problem that you're inviting them in, and then when you put them on the street, where are they? They're in the neighborhood. What are you doing to help the people in the neighborhood? So I think that we need to listen to the people, give them an opportunity to speak, and take their advice. Like, give them some protection or something. I don't know how you're going to do it, but something.
Thank you. So the region has been reiterating that...
Sorry, the what?
The region has been reiterating that only 45 people will be admitted in this first phase. Do you feel that there is confidence in the community in regards to the communication coming from the region?
Comes back to my first point when I asked your CAO, like, how many more people? And when you don't have a plan, we don't know. I don't have any confidence it's only going to be 45 because let's look at it this way. We've heard before that if there are it's a January night and it's minus 31, whatever that is, and all the shelters around are full, they're going to call, they communicate. Whitby's open. We've got beds. How many more come? I don't know. So I'm not confident it's only going to be 45. I'm confident it's going to be over that. That then in the next day when it warms up, where do these extra people go? We're back to 45. You're back in the street. Like it's not a very good business plan. Man, I would run a business that way. I mean, you have to look at numbers.
My last question is, you were at the public meeting just this past week on Tuesday night.
Haven't missed one.
When Mr. Cahagas asked about the appraisal, he was shut down and refused an answer from staff.
Councillor Yamada.
Do you feel that
Councillor
public dollars
Councillor
demand
Yamada.
public answers?
I
Fair
would-
question.
I'd love to answer that question. I don't understand how we spend $5.7 million more in a declining housing market. That just makes any sense. I really can't speak to that other than. But there's one more thing that I'd like to address, if I may. The last thing, and be quick because
So we have a number of other speakers.
just quickly. You had so I looked up the definition of moderator. A moderator is somebody.
Okay, Mr. Lefkins, we're going to stop and we're going to move to the
Well,
next
I would
person.
say it was just
Next
his
question.
Shutting him
behavior
down
was
again.
reprehensible.
Mr. Lefkins, we have.
Reprehensible.
Mr. Lefkins, we have one more question, member of council. Councillor Leahy.
Thank you, Mayor Roy. Okay, I'll be trying to be quick because I know we got lots of delegates. So again, you sound like a kind and caring Whitby resident with so much service in the background, like so many I know. What would you like to see in a better plan that would increase your confidence with the region's plan for the shelter? Like, what would you like to see that would increase your confidence level?
The low barrier part is a concern for me, and I think that definitely we should be looking at background. If any individual has been banned from any other shelter, why are we bringing them to ours? Because it's been a problem. And I think that creates a problem for the people who actually need and want a home, who don't have a home. Because why would they want to go in and sit beside or sleep beside some guy? That's where the violence is created. So the barrier has to be addressed. And I think the maximum number needs to be addressed. Because if Ajax or wherever in Toronto, if they can hard cap and say, oh no, we were full, you got to go to another shelter, why can't we? Is there a reason for that? And to Lisa and Mark, who were just presented before us, I have a great spot that you could include for some of the people who have some disabilities. We have a place on 1635 that'll fit them.
No, and then fair enough. And then my last question just around, what else do you think anything is missing that you would like to see that would increase your confidence level in the plan from the region? Anything else other than the cap?
Well, I think first, as I said, make sure that the low barrier is removed to at least have some screening prior to. I think also seeing that Oshawa needs some perimeter security and they want to move part of their burden over to Whitby to spread the burden, shouldn't there be some security in and around that area? There's lots of children walk up and down that park who would feel highly uncomfortable, whether they're threatened or not. It's not an easy feeling for young children.
No, I appreciate that. Thank you for your time. Those are my questions.
Chair Henry, can you push your button? Oh,
Sorry, it's just for one clarification.
Please.
You referenced the asylum seekers that were in Toronto on the streets last night.
Yes.
We have 324 in Durham region. We didn't have any before June, and they're all housed.
Refugees?
Asylum seekers.
So what do you call them?
asylum seekers.
call them
Yeah, okay, sir,
asylum
yes.
seekers. So they have arrived in large numbers, including on a Saturday, 70.
Yes.
That we've done our best to accommodate all this. But again, as you know, the funding for all this is, you talked about funding, and it goes back to my comments the other night, the absolute lack of leadership at the other levels of government to support the costs. We have to do application-based funding back. I'm just talking about asylum seekers to make sure that we're covered. And if we're not covered, that the residents of the region of Durham are on the hook. But they're all sheltered and being taken care of.
And Mr. Reddy, I only bring that up because I want you to understand that I have compassion for that, and I do what I can to try and help.
But I just wanted to make sure that you know that we're doing our best to make sure that the challenges of people coming from primarily Africa, Ethiopia, and
Right.
Nigeria that have landed here and been been brought to Durham Region by van loads, unknown to us, that we have dealt with that and we're working on it. So I just didn't want you to think that we're putting that burden back out there, but it is something that our team here has worked very hard.
Thank you.
Very hard on. Thank you.
Thank you, Chair. Councillor Jubb.
Thank you, Madam Chair. Through you to the delegate. Mike, thanks for the presentation. I have a very direct question for you. If the region was ever to reconsider the low barrier intake of this building, in your opinion, do you think the community could get behind the plan?
I believe they would. I'd be in favor of it. I think we need homes for them. We need housing. It's important. But the crime aspect is a problem. I don't want it next door. We try to abide by the civil laws, and I don't need people I don't need my wife or my grandchildren or my children to be harassed when they're in the neighborhood. I think that's really a critical problem. So yes, I think people would support that for the most part. I can't speak for everybody, but the people I've talked to.
Okay, thanks for that. And last question is, you referenced Ordco, the consultant. Do you feel that the region should look to a different opinion from a different consultant?
I think that's reasonable, given that Mr. De Jong was pretty instrumental in supporting the Timmins in 2021, the Timmins shelter, and look at the problems that they're having today. I mean, it's phenomenal, the problems that I see. I mean, the problems that the residents are concerned about.
Okay, I appreciate that.
And just one more, Mr. Jubb, if you are going to get a consultant, I think it's important the consultant also consult with the neighborhoods of the shelters and not just the shelters themselves.
Understood. Thank you.
Thank you very much. No more questions. Thank you, Mr. Lufkins. I'm going to turn to online to Deborah Schroeder. Deborah? And if you could press your button.
Thank you. Hello. I will start by saying I'm not nearly as well prepared as Mr. Lufkins, but I do have a few questions that I would like to ask. I'm not sure that you have direct answers for them, but there are questions that are being asked. So one of the things that was just discussed was the confidence in the 45-bed maximum. And I think one of the questions that the neighborhood has is, why would you buy such a huge facility with a capacity of 300 beds if you were only going to put 45 beds in it? That, sounds a little strange. I'm really concerned about two specific groups. And the first group is the homeless that will be in that shelter who have addiction and mental health issues. I'd like to know, what's the wait time to get them treatment? And what are you doing to shorten it? Chief Chesborough just said that Ontario Shores does not have capacity for emergency mental health situations. So we're inviting people that may have addiction and mental health problems into the community with really no capacity to help them. I know that there's wraparound services that are being discussed, but treating them within the shelter, I don't see that as necessarily being helpful. And let's face it, they're not going to misbehave necessarily inside the shelter. So that 10-foot fence really isn't going to help. And the light that you shine that may spill over to the community isn't really going to help, because they're going to go beyond that fence to buy drugs. So you're going to be attracting drug dealers. You're going to be attracting traffickers that will prey on the people that we are supposedly helping. And it's also going to expand into the neighboring communities, the businesses who are, paying the taxes. The other side that I have concerns about is that community. What are you going to do to mitigate any impact to the community? Is there going to be an increased police presence? Is there going to be increased cleaning of the community so that they aren't finding needles and other issues? Will there be access to mental health services for them? Because some of them right now, as you saw at Tuesday's meeting, are terrified. Is there going to be training for them on how to deal with unpleasant situations with situations? Will there be priority calls from that community if 911 is called? Or are they, kind of on the bottom of the list because it's just somebody acting up on their lawn? Is there any support for a neighborhood watch program? And if there are no resources available, what do you suggest that the community do to keep their homes, their businesses safe? They're scared, and we really are not getting even the remotest sense of compassion from the meetings that we've had, from the regional councillors, from the staff. The iciness has been noted. We understand that you have a difficult job to do. We understand that there is a huge issue here. Nobody is against there being a shelter. The fact that you did not consult with the neighborhoods, the fact that there has been no plan put in place, no communication, and the fact that when we ask questions, they're literally being shut down and not answered is a concern. So another question, what's being done about affordable housing? Because if there was affordable housing available, some of the homeless at least wouldn't be homeless. They'd be in housing. As I said, I didn't really do a lot to prepare for this. Those are the questions that I have. I really hope you take an opportunity to put yourself in the shoes of the people in that community. To Kill a Mockingbird said, walk around in somebody else's shoes and experience what they're experiencing. I encourage you to do that, and you'll understand why there is so much acting up at these council meetings. We're scared. Thank you.
Deborah.
Thank you, Deborah.
Is there any questions from members? I'm getting I'm not sure if it's you, Deborah, that's giving the feedback, but we're getting feedback into the audience here. I have Councillor Leahy.
Thank you, Ms. Schroeder, for coming out this evening. And again, just like the previous delegate, you sound like a kind and caring Whitby resident, like so many I know. What would like I said to the last delegate, what would you like to see in a plan to make it better and to increase your confidence level of with what the region is doing? Like, what would make you feel more comfortable? What would increase your confidence with a plan change?
So to be transparent, I'm not actually in that community. I'm literally a block south of you right now. Mm-hmm. But I've been on the WhatsApp groups. I've been conversing with that group. From the things that I've heard from them, take low barrier off the table. Nobody has any problems with families, refugees, a women's shelter, an LGBTQ shelter, but to open the door to what we don't know, and knowing that we really don't have the resources to deal with addiction and mental health problems because there are no beds available. It's just opening up to a scary situation for the residents in that community and the businesses. There's, I think, 2 veterinary clinics and a pharmacy that has methadone in that area. Do you think they're not going to be a target? I think that much better communication and much better understanding. Honestly, the lack of compassion has been outstanding to this community. We're who you represent, as well as the homeless. I get that. But we need to be, our concerns need to be taken seriously. And you need to walk in our shoes and understand that the homes and businesses that people have invested in are the biggest investment they've ever made in their life. And they're concerned looking at neighborhoods like Timmins and Hamilton, around the Novotel, around the Delta, Oshawa. We do have concrete examples of what can happen poorly. So why are we not looking for much better practices? I mentioned the other night that Ian DeJong's study stated that people in shelters don't want to be in shelters with people who have addiction and mental health problems because of all the problems. So he's going against his own study and going, low barrier, bring in everybody. So I have to question his advice.
No, and I appreciate that. And I appreciate the question around looking for more compassion and empathy for all, not those in need and those in the community. My last question, is there anything else that you think is missing in the plan that you would like to see? Because you kind of alluded to it. I was trying to look for maybe some concrete examples that would just make you feel more comfortable that some of the concerns you were talking about are there.
Yeah, the simple things of, increased police presence, increased cleaning of the parks, priority when a 911 call comes in. I believe a stat we saw recently was the Tim Hortons in Oshawa was closed because in 3 months they had 150 911 calls and they couldn't keep the doors open anymore. That's somebody's life savings that just went down the tubes because situations were built that he did not have control over and then weren't controlled. Neighborhood watch, training, it comes down to that you take low barrier off.
Okay. All right. Thank you so much for coming out this evening. Thank you, Chair.
There's no further questions. I'm going to move to Said Ashraf. He's online. Oh, he's not here. Okay. And Mr. Hartley is not presenting. This is a formal council meeting. It's a committee meeting, and we have an agenda we are following. Said is online. Or Saad, sorry. Sorry about that, Saad. Can you push your speak button, please? Thank you.
Thank you. Good morning, everybody. Thank you for having us. I actually had a couple of questions. I think I've made a lot of statements, and I wanted to ask the region and yourself, Mayor Roy, what are your thoughts about what we've heard in regards to in the news, in regards to Timmins, and that they are now looking to relocate the shelter. So I guess what we're seeing is the future at this time, and we don't seem to be looking at what is currently out there. That's my first question. If we could, I'll be quick today, so if we could get an answer to that.
So Saad, could you do your presentation, and then if there's any questions, we will follow with questions.
Okay, sure. So the other thing was, I know homelessness is an issue, so I wanted to know, are you guys going to remain committed to the keeping the warming shelter open by the library in downtown Whitby? My other question would be, as well as that, why must this be a low barrier shelter when there's other shelters that are either family oriented or whatnot? And it's hard for me to consume that we're looking at the most vulnerable when we are ignoring, say, people with disabilities and mental health. And when we hear the word wraparound support, does wraparound support mean that they have access to like telehealth on their cell phones? Because from what I understand, there's going to be no rehabilitation or any type of treatment inside the facility. So how are we setting them up for success in the neighborhood? And the other thing is I feel like when we're building a community or neighborhood, those who are struggling would also like to be a part of that community. I don't think they want to feel any outward pressure from those residents that have been living here for years. Some of my neighbors have been here since the homes have been built. Should they not have a sense of community that they can stay for, a minimum of 6 months or a year, similar to, say, the Muslim welfare residents? As you know, with ODSP, I believe it is, or Ontario Works, those people, if they do leave the shelter successfully, will not be able to attain the housing that they need because it's simply not affordable. I think everybody knows where the rents are today. So it seems like with my questions, the answer or the question I'm really asking for is, if we continue to trust, if we want to continue to help, even though we've seen results that show that there hasn't been success, what if we're right and the region's wrong? Those are a few of my questions. And my last question, I think it was Stella that mentioned, and please forgive me, there's a lot of numbers flying around that I've been going through. But I think she mentioned that there's a $20 million, I think it was, that was spent for the homelessness budget. I'm not sure if that's what the amount was. I'd like to confirmation. But if we spend $21 million on 1635, does that mean that we've spent the entire region's budget? And of course, I think the last thing is, I think some of the councillors have mentioned several times, the biggest concern we have is public safety. And I know there's negotiations, and Mayor Roy, I've mentioned this several times. I'd like to participate. My neighbors on Greenfield and Prince of Wales and all around the area would like to participate in that negotiating, so we know. And from a security perspective, I know there's going to be security inside, and I want to be very clear. I'm worried and concerned about the safety of everyone, including those who we're trying to help. You know, I've mentioned this several times that violent crimes have increased threefold in Toronto in a 5-year period. That actually turns out to 6 violent crimes per day. We don't have the police resources, as the chief had mentioned last week in the meeting in regards to the budget. So how are we going to feel safe if we don't have the resources? The people inside the shelter don't have the supports inside. Does it mean, or does wraparound mean that the pharmacy around the corner, that is considered a wraparound support? Or does it mean that there's going to be that kind of access inside the facility? And I know we've mentioned this quite a bit of times about transportation, but if this location was perhaps, say, in an industrial area or somewhere else, I'm sure we can afford transportation to assist those who need it for, appointments and things like that. So again, I would want you to reconsider this project because I don't think it's the right place. We do want to help. We're open to finding other locations. I'm sure there's other city property, region property that we could be looking at. And we want to continue to press for the transparency and openness. And I, for one, would also like to see this appraisal report because I think it's important to have that transparency in regards to it if we paid such a hefty sum. And I've been told by many, many neighbors recently that now that they're seeing this information about their property tax hikes, they're getting concerned about the misuse of tax dollars. And I know it's difficult to challenging, especially post-pandemic. So I think I've presented my questions, and I would rather hear you guys speak and share some of those answers with me, please. Thank you.
Just in the format of this meeting, the meeting is in terms of its presentations, and we follow agenda. It's not a public meeting, back and forth dialogue. Is there members of the committee who have questions? Seeing none, I have Councillor Leahy.
Thank you, Chair. And just for Chair Roy, just for Mayor Roy, clarification. So for the questions that are coming up from the residents, like that have been mentioned right now, is there an opportunity to ask staff those questions today, or what would be the best format to do so?
We could do it under new and unfinished business at the end of the meeting, but the other is that the questions are being compiled together, and I think it's a continuation, and I actually see even from the other night that there's questions here that will be put up onto the website as well too.
Okay, so those questions that have come up from the delegates today, have they been added to the list that Commissioner?
This meeting is being recorded.
Okay, the Commissioner can answer? Okay. I see a nod, so I'll take that as a yes. Yeah. Now to my question. Thank you, Mayor Roy. So again, just like I've said to the other ones, you sound like a kind and caring resident. Like so many I know in Whitby, you're, again, not opposed to shelters in general, if I can understand your words, but to trying to look for a change in the plan. What would you like to see to make this plan better and to increase your confidence in what the region's trying to achieve in the future?
Great question, Chris. I don't think I have all the answers for that, but I can simply start with transparency and planning. I'd like to see a fully costed plan as to what the operating costs will actually be like. I've noticed that several of the plans that have been in the town of Whitby and in some in the region, I believe, for example, the Seaton project, I was reading that it was actually at $105 million. That's escalated to $162 million. I've mentioned the sports complex several times at $40 million. So it seems to be that the spending doesn't stop when it comes to these projects. And we've went from $13.7 million to $21 million pretty quickly. So an open costed transparency. I'd like to ensure that public safety measures, camera systems, mobile response units, tactical guards, remote monitoring, because I'm worried about and concerned for those who are inside the shelter, especially with the violent crime, the theft. The biggest thing that, if to answer your question, Chris, is if you read just simple articles within a few minutes, and no offense to Ian DeJong's to his report, which I consider flawed and cannot accept, unfortunately. There's a lot of holes in it. I'd also like to point that out, that we want a second opinion, so we have that transparency. And I think it's also very vitally important to actually to take this feedback and show us how we've made steps. I believe, again, that I've heard that we're negotiating, but what are those negotiations? Why are they behind, again, closed doors? If we want to, quote unquote, work together, then we should be at that table together. And my biggest concern for everybody is public safety. I think we've seen the pictures. I know this format doesn't allow to the answers, but when do we get that dialogue? That meeting the other day was cut short, very little dialogue. We've asked questions. They've been on a list. Again, very little dialogue. I just like to have some dialogue. If that means it's a smaller group of people, I would step out and allow those people ask those questions, but we need those answers. And when you have this much cloud cover over this and a lot of secrecy, it seems like, then it's hard to build that trust back, right, Chris?
No, and I appreciate that. That's why I asked those questions. So, and again, and also facts matter. Like really briefly, people have mentioned 20 million, but it's 13.7 for the capital cost, 4.8 for renos, 2.4 for ongoing operational. So that's the dollars to your question earlier. My last piece is that, is there anything else that you feel is missing? So something that you would like to see in the plan that would just make you feel more comfortable, have more confidence in what we're trying to do here with the proposed 1635 building?
Yeah, I think along with all my neighbors' concerns to be addressed. Like I can't stand here selfishly, and I think we should be speaking to those who are unhoused. Even the report that this is, from my understanding, is the genesis of this project. And then when I see a real life example of Timmins, like, why is that being ignored? If you want me to feel more comfortable, I'd like this facts, real time, real life examples. You know, Ian agreed with me when I mentioned that there's no reports for anything post pandemic. That his report did include completely outdated information. It seemed like even some of the report information, one particular case is actually, good question, Steve, Krista, now that I remember, is service providers. There's a level of service providers that are facing shortages with employees and staff. So how do we get the best service provider? If this project, just so I want to be clear, if this project goes ahead, how do we know that? Because I've seen what happens is it's almost like you have a low barrier shelter and you have a low barrier service provider. Because I've seen what some of the service providers are unable to accommodate or fulfill their contract obligations. And then what ends up happening is that, okay, well, we're going to go to another company. The region, town, whomever has chosen the service provider is neglecting the fact that they do have issues. There's reviews on some of them. Some of them are unfortunately, you know, in dire straits. I think there's one in Burlington right now that changed their service provider. So if there was a service provider, I'd like to have the best service provider, because I want to see success. And if there was one thing, Chris, I know we had several challenges. When are we ending homelessness? This plan doesn't have anything about ending homelessness. It's all about continuing homelessness. I know we can't force people, but if you can give somebody CPR, so if you can give somebody CPR when they're dying, that's not a choice. You save somebody's life because life is that important. And so if somebody has an issue, whether it's drugs, mental health, whatever that issue might be, are we not supposed to help them? I don't understand how any constitution or charter would prohibit us from protecting people. I heard, again, you guys can clarify this, that in Oshawa that I can't give somebody food on the street. I believe there's a bylaw passed like that. Again, I'm not trying to bring any misinformation, so I'm saying I've just found out about this recently, if that's the case. Mm-hmm. There's a law like that. So how am I supposed to help them? So to answer your question, those are the things that would make me feel more comfortable as to when there is an end date to this plan, because this can't be here for 20 years.
No, and I hear that. And thank you for that. Yeah, and I have a hard time trying to memorize the Whitby bylaws. Can't tell about the Oshawa bylaws. Appreciate that. But again, I think everyone's goal in this room and yourself is that we all want to end homelessness. You know, Maybe it's a stretch goal, but we're hopeful. And thank you. Those are all my questions.
Thank you very much, and thank you. Moving to our next delegate, Wendy Susanto.
Good morning, everyone.
Good morning.
So I'm here to express some real concerns on behalf of our community. Firstly, it feels like there might be a lack of trust in us, the very people who elected you to represent our voices. We have chosen you to make fair decisions for us. Seeing 6 police officers at Tuesday meetings sends worrisome messages, as if our opinion is seen as potential threats rather than beneficial input. The money spent on hiring those officers for a single meeting could have gone a long way, perhaps feed over 100 homeless individuals in a single day. Also, on Tuesday night presentation, there are 100 residents in this room looking for answers to their concerns, yet we were given very limited time. We pay for every single thing in this room, including your salary, and we deserve every single one of our voices to be heard, inside and outside this building. So during the presentation about the proposed low barrier shelter, we heard a lot about the study, but there hasn't been enough discussion about how it might affect our neighborhood. We need to consider the possible risks associated with the shelter, especially the safety and well-being of our community, especially elderly and children. So we're questioning about the proposed 10-feet fence ability to address the privacy concerns of residents living behind the 3-story building, especially those on upper floors who might still have line of sight into private spaces. This could impact our emotions and daily routines, potentially making us feel isolated and uncomfortable. It is important to note that we're talking about temporary residents with different backgrounds coming and going here, not long-term care seniors who were there before. Many in our community believe that locating a low-barrier shelter in family neighborhood is fundamentally unjust and raises questions about the government's role in permitting such action against its own citizens. We strongly feel that a low-barrier shelter would be better suited in places like industrial area, and the current choice is causing distress within our community. So let's take a pause and maybe do a study first for the community directly affected by this. Their concerns are real. Thank you.
Thank you very much. Thank you very much. Is there any questions from committee members? Seeing none, Councillor Leahy.
Thank you, Mayor Roy. So again, similar questions I've asked before. Like, again, you sound like a kind and caring Whitby resident, like so many I know in town. And what would give you confidence with this plan? What do you think would make this a better plan that would increase your level of confidence for what we're trying to do? That's my first question.
Again, let's take a pause on this proposed plan and we want to hear a study for the directly affected community behind the building and also the business surrounding the building, and to give them a better idea what's coming. I think it's very important to know that before any of this going ahead. I think that's the most important part we got to do now.
Okay, fair enough. And then my other question here, like, is there anything missing? Is there anything in this plan that you've seen to date that's missing that you would like to see included in the plan?
A lot of them missing, especially for again, back to the study, for the surrounding communities and businesses. We like to see what's going to happen if this proposal low-barrier shelter is going. Is it going to cause more disturbances around the area? Is there going to be a lot of more police presence around the area? Be honest, if I wouldn't feel comfortable with police going around the residential community 24/7. I don't want my kids be in fear that wherever they go, they're being watched. So yeah.
Okay, that's fine. I'll leave it at that. Thank you, Mayor.
Thank you. I have no more questions to you. I'm going to move to Oliver Augustus. Oliver?
Morning, everyone. Here we go again. I don't know if I can. I don't know if I can articulate any better than every single one of my colleagues and everyone who has taken this podium and everyone who has sent emails. I think council, I think the region, you pretty much heard it all. And I don't think you're listening. There's a clear distinction between listening and hearing. So I'll say this. The province needs to have a more active role, a more overarching role in clearly the decision-making process as it relates to the homeless issue. There needs to be an overall, an update to factors in new data, feedback and metrics, to the Housing First approach, the Ontario Housing Charter, the Ontario Shelter Standards, the Housing and Homeless Shelter System, Pathway Towards Housing Plan, updated Quality Assurance Report, and last but not least, an adequate bylaw parameters that need ratifying. In the absence of these things, you will have frustrated residents, you will have unanswered questions, you'd have us pursuing a well-intentioned effort without logical and tangible supports. I am 110% in favor of us proceeding with an interim control bylaw. It's become adequately clear that you guys are not listening. It's become adequately clear that there's a lack of trust, a lack of transparency. It's become adequately clear that we're ignoring precedents. And I don't want to put our counselors here with us on spot, but it was made public. I see I have 3 minutes. It was made public with Timmins and Beaverton. And I want to quote Councillor Walter Schumer, who's here with us today. He said, "I cannot support the deal that's been made simply to try to get a win. This is not transparent government, and in my opinion, it's a slap in the face to Beaverton Vision and the many residents who have been tirelessly working with this council to arrive at an agreeable conclusion." Similarly, Mayor Mike Jubb said, without the ICBL, there would have been no concessions. It's signaling that there is a breakdown in communication. There is a lack of dialogue. And what scares me is the fact that we have to go to these extremes to actually have dialogue, to actually have the necessary protocol in place to ensure the safety of our children and our residents. The City of Toronto is a legislated provincial consolidated municipal service manager. You guys are the service manager of the region, responsible for the administration of provincial and federal funding and the planning and management of the housing and homeless service system. There are two types of shelter systems: emergency shelters, which serve individuals and families experiencing homelessness with or without a referral, and there are transitional shelters that serve individuals and families through referral only. And Stella, I want to say something. Section 2.4 of the Quality Assurance Report quotes, "The role of service managers is to monitor, review, and resolve complaints from clients and the community." So Stella, when you say that transients or homeless folks that leave the parameters or the compound now fall outside the purview of the region's responsibility, that's simply not factual. It might be well-intentioned, but it's certainly not substantive. That's huge. If it's not going to be a safe injection site, where are they going to use safely? It's going to be in the community. And I'll say this as well. We don't want to pretend that it's the residents making a correlation between homelessness and substance abuse and mental health. This is clearly outlined in the Pathways Towards Housing Plan. There are several references to substance abuse and mental health. This has taken a serious toll on our community. We need to develop and maintain a respectful and responsible relationship with the neighborhood in which their shelter is located and the wider community. I'll end by saying this. The Ontario Housing Charter states, admission decisions will not be based on clients' substance use. Furthermore, and I quote, emergency shelter providers will admit clients to their bedded program at any time during the hours of operation when there is an available bed in the shelter. Legally, you can't cap it at 45. If there is, in fact, available space sitting there, and I think my colleague alluded to this, which is, why spend $13.7 million to utilize it for 45 beds? It's not fiscally responsible, and it suggests there is something that we're not being told. So I will end with that. There's a lot more I have here, but I want to be respectful of my other delegates. Thank you for your time. I appeal to those regional councillors who are perhaps uncertain as to what their next step should be to do the right thing. We need a pause on this. We need to figure out some stuff before we move forward. Thank you. I will be open to taking questions.
Thank you very much, Oliver. Any members of the committee have any questions? Councillor Leahy.
Thank you, Mayor Moore. I appreciate that. And thank you for coming out here today, Oliver. And again, you also sound like a kind and caring Whitby resident, like so many that I know. Your first statement is, again, you're not opposed to shelters in general. Is that a fair statement?
I want to be very careful when I answer that because everyone seems to be afraid of saying the obvious. I do not want a shelter in the wrong location. We're not proposing putting a nuclear plant next to a school. There are several schools within a close proximity of this shelter. Shelters have been demonstrated to be successful where they are further removed from social engagement. It's been said by the police officer who spoke at the council meeting. He says that he finds the shelters that are more isolated in industrial areas where you can provide the wraparound supports that you need tend to have a better rate of success. In trying to solve one problem, we're potentially creating several others. So, of course, we recognize there's a need for shelters, but we also recognize that they need to be in the appropriate places. This is not it.
And I appreciate that. So what would you like to see in this plan or that would increase your confidence level in what's the region's doing?
Well, for starters, Ian de Jong's report seems severely flawed and biased in favor of the region's positioning. I don't find that I have great confidence in anything going forward based on what I've seen to make a definitive decision on what way to go, which is why we need to pause, have the experts come together, and make a determination that's best suited for this community. We cannot open a shelter up to the entire region.
Fair enough.
It's simply not possible.
And then my last question, just to be consistent. So is there anything missing that you would like to see included, like something in the plan that's, or any gaps?
Absolutely. And I don't want to rehash it, but my colleagues have said it repeatedly. The low barrier references, it's absolutely, it's crucial. We cannot have folks coming in unvetted. It's not right. It's a disservice to them. It's a disservice to the community. We need to absolutely remove that, revisit it. Again, however, we won't know the parameters unless we sit together with the experts, pause, not rush into this because winter's coming, and do this the right way.
Oh, all right. Again, thank you for coming out.
Thank
Those are my
you.
questions. Thank you, Mayor White.
Thank you so much. Thank you.
Thank you very much. And Councillor Leahy, I'm just going to make a comment. I would say all residents of our community are caring. And I want to dispel that the headline that went out was very unfortunate and does not represent who our community is and what our community is about. And I personally had a conversation with the reporter as well because it really put a bad taste as to who Whitby is and it will be and was, and also for the region of Durham. So I think that we just need to be recognizing that everybody in our community is caring. Thank you. I'm going to call upon Sandy Hodder, please.
Good morning, and thank you for allowing me to join the delegation.
Good morning.
My name is Sandy Hodder, and I live on Long Drive with my husband Ron in our daughter and son-in-law's home as their cellar dwellers. We live 1.2 kilometers from 1635 Dundas. Ron and I are so lucky to live in our beautiful basement apartment in this home, as it means we get to see our two oldest granddaughters, Leah, who will turn 14 in a few weeks, and Avery, who's 8. We get to see them every single day. What a jackpot we hit. Our home backs onto the Hydro right-of-way that runs westerly from Thixon and Burns, and it leads into Longwood Park. In the middle of Long Drive, there's an entrance with a paved walkway that takes you over the creek, and then it breaks off to the right just past the bridge over the creek. That paved walkway takes you up past the wooded area on your right, running parallel to the creek, which runs out to Thixon Road. It also leads up a hill out onto Wood Street that is a tight-knit residential area that takes you out to Nickel. The reason I'm saying this is because my granddaughter started high school at Anderson this year. She's not bused, she has to walk. Her route is to cut through Longwood Park. Normally, she would take the long walkway all the way out to the second park at Nickel. It's completely heavily wooded on the left-hand side. I'm worried, and that's her route. She meets up with her girlfriend on Nickel. They walk across Nickel to Hopkins, Hopkins to Anderson. She started doing it in September. Let's see. Okay, I'm speaking today to say that I stand up with all the other angry and concerned residents of the Bluegrass Meadows residential neighborhood and the Prince of Wales residential neighborhood to tell you we don't want this large low barrier shelter operating in our residential neighborhoods. It's too big of a shelter for this area, period. I, like all the other residents, totally support some sort of housing to assist the homeless population. Don't get me wrong. We want to help people, but we have to get people the right help in the right location. And residential and commercial neighborhoods are not the right location for a facility like being proposed for 1635 Dundas. The need for such a facility in the Durham region is needed, but the key problem is its location. This is a town of Whitby, region of Durham issue, and both the provincial and federal levels of government need to come to the table of the municipality and help us and address the issues we, the residents, are facing. I attended the marathon meeting of Whitby Town Council on the evening of Monday, September the 25th, and was registered to speak. I was number 30. I got the opportunity at 11:55 p.m. I advised the town council that night that I was in total support for Councillor Leahy's motion to recommend approval for an ICBL for 1635 Dundas. I stated I'm scared and fearful for the safety of my 13-year-old and 8-year-old granddaughters who use Longwood Park. As I said, my eldest granddaughter started high school. That's her route. I told Whitby Council also that I'm scared for my 8-year-old granddaughter as well, as she and her friends want to go to Longwood Park with her friends to the playgrounds and go down into the creek looking for fish, unaccompanied by her mom, who's my daughter, or myself, for fear that someone who may be camping out in the adjacent woods along both paved walkways. And my biggest worries happened yesterday morning as my granddaughter was walking alone through Longwood Park on her way to Anderson at 8:45. As she was walking up the first walkway that runs parallel to the creek that's heavily wooded up to Wood Street, where she was going to meet her girlfriend and continue the route to Anderson, she heard a rustling from the woods behind her, and that was just as she was coming up the hill, and she thought it was an animal. She turned and saw an old scruffy-looking man covered in dirt following her up the path. He was just 6 feet behind her. He was swaying back and forth, and his eyes were rolling back in his head, so she said he looked so strung out either on drugs or alcohol. And he said, "Where are you going, sweetie? Where do you live, sweetie?" She was frozen in her tracks, and as he came within an arm's length of her, she told me she thought he was going to grab her, and at that point, she took off running to her girlfriend's house located on Wood Street, crying all the way. She tried calling my daughter, who was working from home, 3 times, but each call went to voicemail. She called her dad, who was out in Brampton. My daughter finally got a hold of Leah when Leah got to Anderson and heard what happened. My daughter called the police immediately, and 2 officers came to our home at 9 a.m. One taking the statement of my daughter, who gave them a detailed description of the man. The other officer, I believe, went down into Longwood Park looking for the person. After the police left, my daughter also went down into the park, staying on the paved walkway to try to find him. But she didn't feel safe enough to venture into the heavily wooded area by the creek that runs all the way out to Thixon. The police told my daughter that they would be coming back after school when Leah got home from school. They never showed up to take her statement. I drove my granddaughter and her girlfriend to Anderson this morning for 8:20 and then drove to your headquarters. She told me she was absolutely terrified and she had nightmares all last night. She said she'll not be taking that route ever again, but will now have to walk a long, long drive out to Thixon, up to Nickel, westerly along Nickel to the first side street on the right, where she'll hook up with her girlfriend and continue their walk along Nickel to Hopkins, then north on Hopkins to Anderson. Some of you have likely heard my name before, as I mailed all members of Regional Council and others a total of 35 emails with 17 pictures I personally took on Greenfield Crescent on Friday, September 29th in the afternoon. I'm so angry, enraged, furious, pissed off at what the region of Durham is shoving down our throats in our residential neighborhoods. I'm sorry. I've lived a relatively quiet, easy lifestyle in my 37 years living in Durham region, 27 years in Ajax in the Westney Heights neighborhood from August 1986 to August 2013. Then again, living a quiet lifestyle since moving to Whitby with my daughter and son-in-law in August from 2013 to now. Well, that all changed for me on August 3rd when the region suddenly made their announcement that they had bought 1635 Dundas and were turning it into a low-barrier homeless shelter, right smack in the middle of our residential neighborhoods. This announcement caught our entire community off guard. We're outraged that this went ahead without any public consultation on the matter. The region of Durham's proposal to open 1635 Dundas as a low-barrier homeless shelter smack in the middle of our neighborhood is like trying to shove a
Sandy,
square...
do you have more? How much more do you have?
There, to the other page, there.
Okay, please finish.
Okay, again. The region of Durham's proposal to open 1635 Dundas as a low-barrier homeless shelter smack in the middle of our residential neighborhoods is like trying to shove a square pencil into a round hole. It just doesn't fit. I'm attending every single meeting that is being held from now on. I attended Tuesday's night, had no opportunity to pose my question. I'm attending and speaking on October the 10th and October 30th, and I'm going to continue to be a thorn in your sides for as long as it takes for the region to reverse its decision to proceed with their agenda to open the low-barrier homeless shelter in our residential area. Thank you.
Thank you very much, Sandy. Is there any members of the committee? Seeing none, Councillor Leahy.
Thank you, Mayor Roy, and thank you, Sandy, for coming out this evening. And I appreciate your kindness and your caring. And is it fair to say that you're not against shelters in general?
No.
Fair enough. I appreciate that. What would you like to see in this plan that you think would make it a better plan?
You mean different uses for this building?
Or just something that would increase the level of confidence in what we're trying to do?
Remove low barrier. That's the scary thing.
Mm-hmm.
Why don't you, like we talked about Stella Circle. That's a woman's shelter, as the consultant stated. It works great in St. John's. It's a woman's shelter for girls 16 to 30. Why don't we look at a woman's shelter with an on-site daycare center? Perfect. Why don't we look at a family-only shelter with an on-site daycare? Perfect for our. How about affordable housing? How about assisted living facility, a refugee shelter, an LGBTQ? I'm sorry, I don't have that one written down here. It's in one of my other speeches. Shelter.
Got it.
Anything, not a low barrier shelter, not in my neighborhood.
Okay, fair enough. And then, is there anything in the plan that you know to date that's missing that you would like to see included?
Well, it's too late now. Public consultation. I went to the businesses on Springwood Plaza. I thought I'm going to go in and ask every one of them because none of them had signs up. I started with the new restaurant, Springwood, whatever it is, restaurant. It doesn't open till 5. I walked in. They're preparing for the dinner that night. I introduced myself. I said, I'm fighting against the homeless shelter that's going in there. They looked at me. They said, I'd like to know how you feel about it. We have no comment. I said, I understand that fully because there's a few people on our WhatsApp group who are receiving emails threatening them. And I said, I understand that. You're a new restaurant. You don't want to take a stance for fear of what might happen. But I said, and I told them again, I explained to them what was coming, and I'm speaking up against it. It's too close to Greenfield. It's outrageously too close to Greenfield. I was there on Saturday morning with the group, as dressed as my banana, because I'm known as Banana Nana on our WhatsApp group. And it's ridiculously close. Had your June 14th confidential report. They had a plan attached. Had any of the councillors there who approved this known how close it was to there, you wouldn't have even adopted that report. I don't care. Anyways, back to Springwood. Finally, one girl, when she listened to me and I said, I'm sorry, I'm taking up your time. I'm canvassing the rest of the businesses. And she said, I want to let you know something. We've been told that it's going to be mainly seniors going into the building. I said, you've been lied to. It's a low barrier shelter, which means anybody without checks, anything, is going to be allowed to come in, whether they be sex offenders, whether they be on drugs, untreated severe mental health disorders, everybody. It's not going to be seniors in that building. And I said, I'm sorry I take up your time. I'm moving on to Denair next door. And then my husband's coffee was getting too cold waiting in my car, so I had to drive home. And I went to Greenfield, and I had intentions of getting out and going into Greenfield Park to look for that man who went after my daughter, or my granddaughter, because I only found out about it at 2:30 when I was at Costco, calling my daughter if I could make carrots for Thanksgiving dinner on Sunday as well. And she sounds so distressed. I said, what's happened? Don't you read our WhatsApp? I says, Jen, I've been out all morning shopping and meeting with friends. What's going on? And that's when she told me. And I started crying in my car. My fears that I expressed on September 25th came true yesterday. And that is before the homeless shelter is even opened up, that more people are going to be there. My neighbor operates a daycare on her street. She takes little kids that are from 1 to 4. Every day she's down in Longwood Park. And every time there was a man there smoking weed, right sitting on the bench there by the playground. She told him, you can't smoke weed within so many feet of these children. Mm-hmm. And he just looked at her, kept smoking weed. She says, don't you speak English? And he was about a 20-year-old, right? Smoking it. She kept it up, and I think he moved away. She found him again another 2 days, this time sitting on the big rocks around the sand pit, smoking away. And she warned him again, you're not allowed to smoke within so many feet of this. And she says, if you don't get out of here right now, I've got all these young children, I'll be coming. And she called her husband, who was working from home on Long Drive. He came running down to the park. The minute the person saw her go up with her camera to get his picture and her husband running, he took off running up the walkway onto Wood Street. We had a vigilante group, last night. Mm-hmm. My son-in-law, my granddaughter, a neighbor across the street, another neighbor across the street, his wife, their son, wanted to go into the park at dusk because that gentleman who came after her is in the woods there. You can't see him during at night. They wanted to go down there and see if they could see him lurking around because there's all sorts of other activity happening in that park after 8:30. It was too dark. They weren't venturing into that wooded area. That's the area, not my 8-year-old granddaughter goes down into that creek, mm-hmm. but not to the one out by Thixon, but just up from the bridge. They play down there without their mom, without me being there. That can't happen anymore.
No, and that's fair. No, and I appreciate your passion. And I know. So I'll leave it at that. I appreciate that. And those are my questions, Barbara. Thank you.
Thank you. I'm going to follow up with you, Sandy, on this whole situation of Longwood, which is that needs to be addressed now. Well, the officers did not come to your home.
No.
We're going to reach out to the inspector for Whitby and have them contact you.
It's to contact my granddaughter. My daughter gave as best as a description, but Leah wrote me it all out last night.
We will get them to contact, through this whole
come
situation.
to our house after school tonight.
Well, and the other is that to go out into the park, I would advise that's not the approach, but rather that we need the police to be involved in this. I know they did
We'll be calling them every single day.
I appreciate that.
Okay. Whether they respond or not. But even I started to venture down there. When it got a little bit dark, not too dark, I was on my mission because I said, Leah, you want to come with me? Because that man won't be there during the day. He came to you at 8:45, scared the crap out of her. She's a fast runner. She's in flag football. She's in track and field, 100-meter. She took off running, sobbing all the way to her girlfriend's house. And for this to happen, and me crying in the car yesterday at Costco that my worst fears have come forward, I'm not standing for it. I'm at every meeting speaking. You're going to hear the same speech from me until this decision is reversed. We don't want a low barrier shelter there. We don't.
We're going to, I'm going to contact Mitch Martin, our inspector, to
Thank you.
To follow up with
Yeah.
this. Thank you. I'm going to move on to the next presenter, and Travis Teach. Yeah, we'll do it right after the next one. Go ahead, please.
Is it on? Here we go. I will try and make it quick because I actually have spoken at a couple of these assemblies. So thank you very much, Council, for having me here today. I appreciate that you let me into your home, and I think it's very interesting and eye-opening for me. Chair Henry, the other night you were very passionate about what you needed, and it's clear to me that there is a willingness for everybody to solve this problem. There really is. When I hear the chief of paramedic services over there and talk, and he puts up the numbers up on the screen there as well, it's clear where there is a problem, right? The demand is exceeding the supply, or the other way around, however you look at it. I'm of the mindset that we can figure all of this stuff out. I really, really am. I think, though, that we need to do it in some due time. The thing that's been very obvious to me throughout all of this today is there's learning to be done. There's problems. There's lack of resources. There's lack of money. And we're not going to solve the world and all the problems in one go at it. But to Banana Nana's testimony there, it does feel like it is a bit of a rush. It does feel like it is a bit of a square peg in a round hole situation. And I think that all of us have probably been taught since kids and have probably learned this lesson over and over time. If you rush something, it's going to backfire, right? And if we rush a model that we're all concerned about that might not work, that could be bad. I'm worried that, you look at what's happening in Timmins, and right now they're talking about retracting, right? That's not a good look for anybody, right? To put something in place and then have to pull it back. And I really don't want to see the region go through that. I don't want to see the municipality go through that. I don't want to see our neighborhoods go through that. So what I want to say here today is it's sort of a call out to everybody here and the regional councillors that are on the line and those that are in here as well. We're calling out from the bowels of this community to say, again, we're not against a shelter. The area for it is a little questionable. If it goes through, we want to work with you on it. But we think that it would be beneficial to step back a little bit and start to consider a few things. The safety of the community is paramount. I think that we all understand that and we all know that. I don't know if the actions are necessarily there. And like I said, just to put everybody in our positions, right? We've been called everything under the sun. I always look at the basic human characteristics we have, right? Every single one of us in this room and on this line has a primal instinct within them. Someone's got a mic on. If you feel threatened in any way, right? It's a fight or flight. It's a primal urge. Every single one of us has this. You can't deny it. Okay. I recently realized they've put a name on that, and that's called NIMBY. And everybody has that. Everybody's NIMBY. Every single person in this room or on the line, right, is NIMBY. It's terrible to see that that's being used as a negative thing towards people now. Say, well, you're afraid of, your family's security, your land being your neighborhood. That's bad, right? It just doesn't make sense to me. And I think that the people who are saying that we are NIMBY, I think you have to question, is there anybody coming forward and volunteering their neighborhoods? Is there anybody saying, hey, I would like to have the next shelter in my ward? I'm willing to bet that nobody stood up and said that. So please put yourself in our position. The community we live in, I'm off the Prince of Wales community in Bluegrass Meadows. Greenfield community has very legit concerns. We have a green oasis across the street that runs a valley through a ravine. We're very concerned about overflow, people ending up in there, encampments maybe being set up. We're putting up a beacon in the region for everybody to come and stay here. What if there's meal services for the community? I don't know. I don't know what's in store. People could live in the bushes, in the shrubs, in this ravine. That extends north of Manning as well. There's a green belt that goes through the houses. In fact, I think that the ravine is actually part of the green belt, so we should be concerned about that too. Somebody can fact check me on that one, I don't know. But Commissioner, to your point, when you said the other night, you said, hey, once they're off, I'm paraphrasing here, once they're off the property, there's nothing that we can do. They're normal citizens, right? But when you bring that over into the neighborhood, that's a real scare. And I know I'm out of time. I didn't really write anything here because I can't even read my own terrible writing. But that's what I want to say is it's a call out to the councilors. Please just consider this position. People are afraid. They're scared to death. The fights are sitting here, and we want to work with you. We want a dialogue. The fight or flight. The fight wants a dialogue. The flight are looking at selling their homes. Okay, and not to say that they're taking a poor choice or a poor road. They're doing what they need to do to feel safe. So for the ones that are here and want to work with you, please, let's have a dialogue. Let's have consultancy. Let's not wait until the second phase or the third phase. Let's start doing that now. Let's maybe have a pause here and figure this out before we all end up in a situation where we can't pull back. It looks bad, terrible for everybody, whether you're a politician or you're a citizen or you're a neighbor or somebody in the neighborhood. That's my request to you. Thank you.
Thank you, Travis. Any members of the committee? Seeing none. Councillor Leahy, and Councillor Leahy, could you just recognize time as well?
Yeah,
please?
I'll be super fast. Again, just like I said, appreciate your kindness and caring in here as a resident here. I guess my question is, so you mentioned about phase 2, phase 3, whatever. So would you be more comfortable seeing like the whole 70,000 square foot facility planned out first? Is that what you mean by that? Or what do you mean?
I think some transparency there would be lovely. I've heard various things that would be good to know. What I'm referring to as a phasing is more, we want to put the 45 people in here now, off the by name list. I'm not really sure what walks of life those folks are coming from. Mm-hmm. And then we've been told that we'll have the community advisory board to start to consult with on what happens next and next after that, right? So I think I'll echo the same sentiment. The opportunity was missed, right, with the community consultation in the first place. I'm wondering if we can move some of that consultation up until now. Is there still a window where we can do some consulting on this before it is the 45 people in there and maybe this train is already too far in motion? Yeah, I guess that's what I would like to say. I think I understand the start small and then work towards big mentality. I take that in my work and life approach in general as well. I'm a little worried that maybe the small is maybe too big still.
Fair enough. And then my last question, just is there anything missing in the plan that you would help increase your confidence with the region's plan that you would like to see included?
Again, I think there's, the concern is the neighborhood security, right? Of course, and so there's the concept of the low barrier, right? And removing that would definitely go a long way. But like I said, people are just scared. We haven't been alleviated of that fear, right? And I think if you can tackle the fear and maybe some of the misnomers around all of that, you can start to make us feel a little bit better. I think we all really want to work with this, right? I would love to see a time when the community gets behind this. Like we got a big park in Prince of Wales. It would be great to have a fundraising barbecue where the neighbors are there and we're contributing to all of this. Like that would be fantastic. It really would. But if you keep the fear there in the community, that is the thing that is not going to get us there. That you're not going to get the community rallying behind this if the fear is still there. And I think we could all agree the other night was maybe didn't go as well as planned. But some community consultation. I understand there's something for Greenfield. I'd love to see something for the Prince of Wales community because we are the two adjacent communities. Let's move towards that dialogue and alleviating that fear because it exists. And I can't go into a million reasons of how we could fix it or whatever,
Totally
but
get
it just needs to happen on the side. Right?
Yeah, more information, address the
Yeah.
fear. Got it. I
Yeah.
appreciate it. Thank you.
Yep.
Okay, there's no more questions.
Okay,
Thank you very
thank you,
much.
Madam Chair.
This is the last delegate, and then we're going to take a 15-minute break. Emma Rosa.
So good morning. Thanks
Good
for
morning.
the opportunity to speak here today. To be honest, there's not a whole lot more that I can say that hasn't been already said, both here today and at other meetings. And Travis is my neighbor. I live about 900 meters away from the facility in the Prince of Wales area as well. When I first heard about the shelter, I was open to it. I would say I'm a pretty open-minded type of person. I already belong to a community that tends to be, racialized and stigmatized as a member of the 2S LGBTQIA plus community. But when I attended the meeting on August 30th, I was sorely disappointed. The way that was handled and planned left a lot of unknowns. I mean, if you work in any organization, you know that planning is important. There seemed to be no plan. Looked like a consultation, a visioning exercise for the community. But the community had no information. How was I supposed to answer questions such as what wraparound services do I see being needed in this area? I'm not the expert in social services, you are. I would have appreciated information, awareness of what it was that we were facing so that we could have a constructive dialogue. Instead, you did not have a constructive dialogue that evening, and that continued on to the subsequent meetings that we've been experiencing. So do I have questions? And maybe, Chris, I'll preempt your questions with some of what I would like to see going forward. I think your change management plan is not strong. The awareness is lacking. Without awareness, you'll get no desire from the community to participate willingly in this. I think if you had, taken steps to be proactive and informing people, not just of all the good. There's great good here, absolutely. We're going to be able to help people, get them off the streets, and house them, give them the supports that they need, hopefully, and then build that desire for us to participate as a community. One of the things I would like to see is a more robust plan. The presentation on Tuesday was very high level, not enough details for myself, not factual enough. I'm curious about what your KPIs will be on this project. I saw that your consultant had some in his report, which are only, again, shelter perspective. And I urge you to be broader, more inclusive of everybody else's perspective. So things like, are we measuring adverse effects currently in this neighborhood? How many needles have you picked up from the Bluegrass Meadows Park right now? And I know that's not going to be the biggest problem, to be honest, but people are worried about that. So do we have a baseline for that? And can we measure if that changes? And furthermore, what would be the strategies to address the increase in some of the adverse effects that we may see happen around this area? Okay. What gets measured gets done. I think that's something that we're all familiar with, that line. If we're not measuring both success of the project as you intended to have, and also for what the community needs, the community feels that you will not act on the adverse things that we might find happening to us. Okay? The other thing, if you want to know what else I would like to see, I would like a second opinion. I think somebody said this on Tuesday. I don't go to the doctor and just get one opinion. When I was diagnosed with breast cancer, I got two opinions. I wanted to make sure that, we were right about what they were talking about. And Mr. De Jong had, very well spoken, spoke about peer-reviewed literature. That's great. Who funded that literature? We all know that the tobacco industry funded a lot of, research saying that tobacco was healthy. back in the day. So it's important. Things said in vacuums are that. They're just vacuums. They're siloed. I'll leave you with a quote I use in a lot of my training. To the frog in the well, the sky is a circle. Please come out of your well and have a conversation with all of us.
Thank you very much, Emma. Emma, I do know that yourself and Travis had asked about this on the other night. While we are having a small meeting with the Greenfield residents, I believe that the same request is coming forward from your small area as well too. And I'm not sure if that's something that could be accommodated, but a small meeting with this area across the way, if we can get that coordinated as well too.
I'd appreciate that.
Yep.
Small gestures like that go a long way, optically.
Thank you. Councillor Yamada.
Oh, Chair, I'll wait for any other members of council first.
There is no other members.
So thank you for coming in. My apologies. I had a doctor's appointment that I couldn't reschedule. What would you like to see done differently in respects to this plan?
So with all due respect, I haven't seen the plan. I've seen things said about what the plan is, but no concrete evidence, factual evidence. So I'd like to see more of that, some factual information that supports certain claims, certain beliefs that are being brought forward. Let's have some true data to support that.
Thank you. And since the initial press release went out on this project back in the beginning of August, residents have not felt confident. What do you think would bring back that confidence that's missing from the community?
That's a tough question. You have an uphill climb from here. So I said it would have been nice to have done this the right way with a robust change management and communication plan. Holding meetings in places like this is not helpful. There is a power imbalance that is not being broken by the location, a power imbalance by the way that you sit there calmly collected while the residents have emotions, okay? So I think breaking down those barriers, come out, let's have a meeting at Bluegrass Meadows Park. It's nice, it's big, Travis spoke about a barbecue. We held a barbecue last year as a community. We raised funds and food and donated it to Feed the Need. We wanted to do that this year again, and we didn't do it because there is so much divide about this project. We had to cancel it. It was supposed to have been held 2 weekends ago. And myself, my partner, and 2 other people that helped organize that barbecue made the hard decision to cancel it because we didn't want that location, that event, to turn into a debate about what should happen at 1635, what shouldn't happen. Come meet us where this is about to happen. That is the community you want to serve the unhoused. Well, come meet the community where we are.
I'm always open to coming out in whether it's a park or the side of the street to meet residents. So understanding that the region has purchased this property, what kind of shelter do you think would best serve that community?
Well, I think I'm aligned with what everybody else has said here today and previously. It's the low barrier that concerns me as a resident. There's lots of other, groups that need help. We heard today a great presentation, talking about 18% of those members that require use of homeless shelters. So let's be focused on who we can help. Let's put in some services that support the communities that we want to help. Selfishly, I'll speak around the 2 SLGBTQIA community. It'd be wonderful to see a health clinic dedicated for that group of people. Even a youth clinic for that would be really, really a really good idea. The community is, there's lots of children. You've heard that, schools, playgrounds, green areas. It would be a beacon for people that, have families, have children. But if I recall correctly, Stella, at last Tuesday's meeting, you said that the facility won't be ready for children as phase one. That concerns me because you've also said that the people that we need to help are families living in cars this winter. So we're not helping them if it's not ready.
Do you, and I guess my last question, and I asked this at the beginning, in terms of the spend on the project, do you feel that public dollars require public answers?
The short answer would be yes. I will elaborate and say that before August 30th, I didn't care much about politics. What I didn't see, didn't hear, didn't keep me up at night. Now, it keeps me up at night. Some of the decisions that are made, how they're made, how transparent they are. Yeah, it's a problem. I work in a hospital, and everything I say and do can be put on the front page of the newspaper because I'm a public servant. So yeah, if it's taxpayers' money, we need to be able to clearly articulate how and why it's being used the way it is.
Thank you for coming out. I'll keep fighting for answers for you.
Thank you.
Thank you. There's no more delegations. I need a motion for a 15-minute recess. Chair Henry, second by Councillor Anderson. All in favor? And we will be returning at 12:15. just doing the roll call first. And then we'll, okay, and thank you. Just need to bring my agenda back up. Yeah, okay, thanks. We have no health correspondence or reports. Thank you very much. Seconder on the moving, Councillor Anderson. Is there any polls on anything? Did you want to speak, Chair Henry, or no? That was just from before. All in favor? Thank you. And now moving on to the rest of the agenda. I know that previously, and I know that Councillor Leahy has left and the audience has left, which is unfortunate because I believe that under new unfinished business, that's any questions. But I don't know if the opportunity is here to be asking the questions and give answers when nobody's here. Councillor Yamada, did you want to ask questions?
Chair, through you to staff. So from all these public meetings from the 3rd to the delegations here today, how are these answers, how are we going to take that information and answer these residents and get that information back out to them?
Commissioner?
Through you, Madam Chair, we are collecting these questions. Many of these questions have been answered on our frequently asked document on our site, Councillor, and we will continue to respond to the questions that way. There's clearly some clarity needed on what we mean by low barrier shelter, and we'll need to clarify that. It's basically not being discriminatory is what it is, like we are with all of our services, programs, everything that we deliver in the entire region, and as you do in all the local municipalities as well. So we will clarify that so people can understand that. Other questions that came up, we will do our very best to respond. I just hope that people read the frequently asked questions, and if they have further questions that we haven't responded to, we are very happy to do that as well.
Thank you.
Is there any further questions to either health or to social services? Councillor Anderson. Can you just hold on?
Oh, just one question. Right, it came up. I don't want to misrepresent what was said, but someone said that there would be pedophiles in this. I don't think that's even possible, but wouldn't that be vetted, and that would never happen under any circumstances anyway?
Commissioner?
Through you, Madam Chair. There is an intake process, an assessment process, Councillor, that all of our shelters go through. So, all of our shelters today are low barrier. So this is not anything new. This is how they all operate, free of discrimination. So there's an assessment process. We assess for weapons and other activities. And if there's anything that is of urgency, we do call the police to manage those types of issues.
Hold on, I'll put you back on. There you go.
That's what I thought, so I just wanted some clarification on that. Thank you.
Okay. Councillor Mulcahy.
Yes, hi everyone, thank you. Through you, Madam Mayor, to staff, just wondering how quickly do we think we can get some of these smaller community meetings together for the Greenfield Crescent and for the Prince of Wales people?
Commissioner? Through you, Madam Chair. Yes, Councillor Mulcahy, we have a date already identified for the Greenfield group in our calendar, then we're sending out some information by the end of this week. It'll be a mail out from the region directly to the 50 residents that have been identified in that neighborhood. And today we did talk about the other neighborhood, Regal Briar, and we will endeavor to do the same. I don't have the date for that. I'll have to speak with my staff and Mayor Roy, of course, so we can coordinate that.
Okay,
Further?
thank you. I do think Sorry, can you hear me still?
Yeah, we can hear you.
I just think that, the unknown and the length of time that they wait for answers and that collaborative approach, just it starts to create that untrust. And I just want to make sure that we're communicating that we're putting it together for them so that they can have some peace of mind that that's coming. So thank you.
I think the other thing that has to be identified is that the liaison committee applications are being completed, and members of that committee will be announced. Is that correct?
We've sent out the applications in draft terms of reference to the many residents who've shown interest, and we've asked for a reply by the 13th of October, after which point we will start to vet them. And if we do have many more to consider, we will have one-on-one conversations with people in order to get down to the 15 that we need.
Okay, appreciate that. Anything further, Councillor?
No, thank you.
Okay. Mayor Foster.
Thank you, Madam Chair. So on a theme to the Commissioner, Councillor Yamada was asking about information coming out. You referenced the FAQs. Are we looking at updating the FAQs to include answers to some of the things that we heard, and perhaps pushing the information out? So we are hearing on a regular basis this fear of it being a huge shelter, 200 people, not limited to the 45. So some of that information is apparently not getting out as effectively as we'd hope. So what's the path forward, I guess, is what I'm asking.
Commissioner.
Yes, through you, Madam Chair. We have been continuing to collect all of the questions that have come through, even from the other night when we had our community meeting, and whatever additional from today. We do recognize there's a lot of clarity that's needed in some of these questions, but our communications team regularly updates them, and in coordination with my team, of course.
Okay, so we'd see that updated imminently. Is that fair?
Yeah, yes, definitely. And I think you talked about pushing out. We will talk about how to push out further to the community so that we can make sure that they go to the link.
Perfect. Commissioner, thank you. Madam Chair, Mayor Roy, thank you.
Thank you, Mayor Foster. Mayor Schumer.
Thank you, Madam Chair. You can hear me okay?
Yeah, we can hear you okay.
Okay, thank you. Sorry if this is a bit of a repeat, but Councillor Anderson asked a question, which I thought was more or less a yes or no question, but I didn't really get a yes or no kind of answer. So I'd just like to ask the Commissioner again. So with respect to the concerns about the individuals that may go into the shelter, through a low barrier shelter, could a convicted individual, regardless of the crime, I mean, Councillor Anderson used a pedophile, but I'm just going to speak generally, any convicted individual could end up in this shelter?
Commissioner.
Yes, through you, Madam Chair. Mayor Schumer, anybody, if you have a criminal record, yes, you could be part of our shelter system, just like you are likely in our neighborhood today and working with us as well. So,
thank you. I just wanted to get that clarified because it really was a yes or no question, and it didn't seem to be. Thank you.
Councillor Yamada.
Thank you. So with the amount of people on the by name list, hearing the presentation earlier today, do we know approximately how many people would have developmental disabilities that would need to access a shelter like 1635?
Commissioner?
Through the chair, I can't answer that right now, how many have developmental disabilities. Councillor, I'm not sure if we even collect that, but certainly I can work through even our provider that was here today. They obviously have some more information for us. We can have a conversation with them too.
That would be terrific. Another question in terms of the second and third floor of this building. So it's my understanding that the $4.8 million to do the remediation was for the first phase or the first floor only. I've been hearing a lot about the need for federal and provincial monies to come forward. If those monies do not come forward, how do we go about further remediating floors 2 and 3? Because from my experience, and when Sunnycrest was going through the pandemic and the problems that were being faced, I was being told by PSWs who were working there that the third floor is infested with mold, and that's why it's off limits to the people who work there, and it's just used for storage.
I know this question was asked yesterday at Works as well, and was there an answer at that point in time, or the information was going to be gathered?
My question was different. I'm now asking about floors 2 and 3.
I guess I'll jump in, and Stella, if you want to add. First of all, in our ongoing discussions, provincially and federally, as we continue to advocate for the diversity of housing that's needed across the region, we have had every indication that when we're ready to go on this project, it would be considered shovel-ready and would be eligible and likely a priority for both orders of government. In a worst-case scenario, that did not happen. It would ultimately be accommodated as part of our capital budget, which would be subject to council approval. And in fact, the application and the vision for the future that we would be taking provincially and federally would also be subject to council approval.
And my final question is the moderator for October 3rd. How is he selected?
Our regional solicitor assisted us on that. We recognized at the time we were expecting a much larger meeting than we actually had, and thought that we would benefit from a facilitator that was not a staff person or a representative of the regional council. So it wasn't easy to find a facilitator because I think the tone of the meeting had preceded us, but Jason was able to recruit the justice.
Thank you. And I would hope going forward, if more meetings are to occur, we find someone different, because the residents and the feedback I'm getting found that he was arrogant and condescending to them. Thank you.
Thank you, Councillor. We're moving forward on our agenda. Any further questions on health or social services? Seeing none, our next meeting is November 9th at 9:30. Can I have a motion to adjourn? Chair Henry, second by Councillor Dyes. All in favor? Thank you.